Panogita moru purita nonda kantai mantunat nyagi toru ilugar para honra para gloria abibai islasen para honra para gloria abibai islasen para Gitodui tempui paz para hita dan gini langit na bendition Contrai peligro na fansafuham Deus protege Islanguam Contrai peligro na fansafuham Deus protege Islanguam.
We hope that you and your loved ones are safe and healthy during the COVID-19 pandemic. It has been a challenging time for all, but now, more than ever, our cancer patients and caregivers need us. Although we are apart, we stand united in the fight against cancer. The American Cancer Society Guam is excited to announce our first virtual Relay for Life. Join us on Saturday, June 27th at 6:30 p.m. on KUAM TV 8, as well as on I-94 FM and streaming on KUAM News digital platforms. Cancer does not stop, and neither can we. On June 27th, let's celebrate together and fight cancer. Visit cancer.org/GU to find out how you can participate in the 2020 Virtual Relay for Life Guam. Calling all graduating seniors. Join us by showing your class pride in the celebration caravan you deserve through the island's major thoroughfares. KUAM and its partners want to recognize your accomplishments and help celebrate this pivotal moment in your lives. To participate, email promotions@kuam.com and let's get this show on the road. Special thanks to ABC Stores Guam and The Dungeon.
Morning, Sabrina.
Good morning.
All right, let's do it. Thursday. How many of you guys out there thought it was Friday because Monday was a holiday? But the whole last few months has just been weird. Keeping track of time. It is Thursday, the 28th day of May, P-Core 2. As we are just ready for more reopenings. The big news from the press conference, and we got all that info for you guys. Of course, real information, real time. It's the KUAM News Takeover, Guam's favorite, containing COVID at 624. Proudly brought to you by Cowboys Insurance, Ambrose Inc., IT&E, Coast 360, and the Bank of Guam. Good morning. So many ways to catch the show right here on the radio, where we like to jam out a bunch of local jams. You know, my uncles and my grandpa, they used to wake up early and listen to Isla 61 way back and drink their coffee, so kind of recreate that vibe as we drink our coffee and wipe everything down in here. It's procedure. It's the new normal. Disinfect everything. Good morning. As always, a great, big, huge show. There's a live stream, KUAM.com, the KUAM News app, audio stream, Docomo Channel 10, and 8 o'clock we jump over to KUAM TV 11. And as always, last but not least, on the Edward R. Murrow award-winning social media networks of KUAM, good morning to our Facebook Live viewers. Let's get right to it at 6:25, as we always do. We'll start the day with a dive into COVID-19 headlines from the KUAM News team. Good morning, Sabrina Salas Matanani.
Hafide, and good morning, everyone. A total of 141 samples were tested at various labs around the island, and one turned up positive. Additionally, there was one new probable case from the Guam Regional Medical City, bringing the total count of COVID cases on Guam to 171, with 5 deaths and 143 released from isolation. Governor Lulian Guerrero made some major announcements during a briefing on Wednesday afternoon. Starting tomorrow, 8 o'clock in the morning, you will once again be able to sit in a restaurant and enjoy a meal, but only half the room will be allowed in at one time. Salad bars, buffets, and self-service operations of any kind remain prohibited at this time. Outdoor dining is allowed and recommended. Food courts, bars, and taverns will still be closed. Places of worship and nonprofit organizations will also be open, but again with 50% occupancy. Private physical activities will be allowed, such as Pilates, yoga, dance, and CrossFit under limited occupancy, but gyms will still be closed. Public gatherings at beaches and public parks will be allowed. There will be a limit, though, of 25 people for that barbecue. The governor also announced she's relaxing restrictions effective on the 1st of July for visitors, specifically from Japan, Korea, and Taiwan, meaning she's lifting the 14-day mandatory quarantine upon arrival. During the briefing, our Nestor Lecanto asked about the island's tourism and economy.
Governor, I just wanted to get back to the issue of the July 1st reopening of tourism. Have you had a chance to speak with GVB and former Governor Gutierrez and discuss how they're going to market Guam? What sort of things are they going to highlight, for example, that Guam is relatively safe, that sort of thing?
Yes, actually, I've been in close communication with the team at GVB. And in fact, we just met yesterday and worked through the decision to prepare our industry to open on July 1st based on the importance, Nestor, to make sure that we give them a heads up so that they can prepare. And they are going to be working very closely with their market contacts, and they're going to be looking at how do we attract and, again, incentivize and persuade the market to come. Of course, they are they're very mindful of the fact that at the beginning, we're not going to have a huge amount of tourists coming in because, again, it is a mindset, right? Oh, is this place safe? We are going to market that Guam is safe, and we are going to market that we continue putting in measures to continue making it a safe place. That's one of the things, especially in light of the fact, Nestor, that with our low numbers in COVID cases, our low fatality of COVID cases, and in fact, in light of the fact that we also were just as aggressive and just as proactive in putting in these measures as South Korea, Japan, and Taiwan did, and as a result, they have been successful in containing the coronavirus also. So we are going to continue using our measures to keep our place safe, and we will be able, I think, to bring back our industry. And also, I'm very appreciative of GVB and the task force that former Governor Gutierrez has put forward in terms of close communication and close marketing so that we can, again, bring our tourists back to Guam.
And the second question, Governor, is are we starting to see a shifting of your focus, your administration's focus on the looming economic crisis, if you will? We've asked several people in the government about, the revenue projections for GovGuam. There's no clear-cut answer on that, but the conventional wisdom is that we're in for a little bit of pain next fiscal year. Can you discuss a little bit about that? What are what is your visibility in terms of government's revenues and the government's ability to fully operate?
I think we continue to focus, Nestor, on making sure our people are safe and making sure our people are healthy and making sure that we don't increase our fatalities. That's foremost. And we've never really shifted our focus from that. We are very concerned, of course, of our economy. We are very concerned about the potential losses in revenues. We are also very concerned about the losses in jobs and, of course, businesses that are not able to maybe start off rebuild again, but we are making sure that we are helping them in every way we can through financial means, through resources, through training, and so forth. So we are focusing a lot of our effort and a lot of our energies with the help of the business community and with the help of the whole community, actually, with help of financials, to rebuild again our economy.
The governor is expected to extend her public health emergency declaration, which is set to expire on May 30th, for another 30 days. Senator Pito Tulahi, meanwhile, reacts to the governor's announcement that Guam will be opening to visitors from Japan, Taiwan, and South Korea without requiring testing for visitors. Quote, "Without testing visitors first for COVID-19 before they travel to Guam, we are opening ourselves up to a greater risk of a second wave and another lockdown. This does not do any good to our viability as a tourism destination, nor does it protect the health and safety of our residents. Just like we make sure air travelers are not carrying weapons or explosives before they travel, we need to make sure they are not carrying COVID-19 and inadvertently spreading harm to others. This must be done by doing tests. It's common sense." The signed contract with Hotel Santa Fe to be used as a quarantine facility for the government is being reviewed by Adelup. Over the weekend, the more than 60 passengers that were forced into quarantine there were moved to another quarantine hotel because of concerns and issues. Calls to GSA to get an answer as to what happened have gone unanswered, so KUAM asked for an explanation during the governor's briefing on Wednesday.
Can you clarify what was the problem with Hotel Santa Fe? Because we're hearing that it didn't meet standards. We've tried to get a hold of the chief procurement officer who oversees the procurement for the government of Guam normally, Claudia Faji. However, we haven't got a response. We heard there were issues with it though, and we know that people quarantined there were moved to another facility. So I guess my questions are, how is that possible if you guys conduct a walkthrough prior to signing anything? And is that contract still in effect? And is anyone going to be held accountable for that?
I'm going to just say that I don't handle the procurement of the facilities for those isolation or quarantine. Our role at the department is just to look at the facility and ensure that there is some type of negative air pressure, ensure that there's containment for infection control and so forth. And that's our role in regards to what we're doing at our the department. So I will diverge that question to perhaps the governor. Maybe she can elaborate more on that.
It's a matter of having a contract and services that are to be delivered are delivered. And so there was not adherence, but the services that they said that was going to happen didn't happen. And so it was to the point where we wanted to make sure that our people are, in a much better facility.
In other news, former Jotnia Mayor Jesse Blas could be released to third-party custodians on strict pre-sentence conditions. U.S. District Court Judge Chief Frances Teninga Gatewood is inclined to release him, but says she wants to sleep on it before making a decision. Adriana Cotero reports.
The court stating to Blas, quote, "If I were to release you, you better not screw up. I rarely release people. This is an important case to the United States government, to the community, and to yourself," unquote. Earlier this year, former Zotnia Mayor Jesse Blas pled guilty to extortion charges for allowing drug trafficking through Zotnia mailboxes. Sentencing has been pushed to August. Defense counsel Joseph Rosano argues the Hagåtña detention facility is unsuitable and unsanitary to conduct attorney-client discussions. Additionally, there are concerns of improper medical treatment. The government strongly opposes Blas's release. This afternoon, the court heard arguments from both parties. Went on a virtual live tour of the lockup, questioned the potential third-party custodians, being his 24-year-old son, Bo Blas, and his girlfriend of 15 months, Stacy Coletta, who reside in Blas's residence. The court also heard testimony from federal marshals, Department of Correction officers, Blas's doctors, and Blas himself. During the teleconference hearing, Blas spoke out despite his attorney's attempt to cut him off. Blas stating, quote, "Your Honor, I would not even attempt to contact anyone, whether they are named or not named. I never had any interest to contact them. I have pled my wrongs. I have accepted my responsibility. I always thought as a mayor my duty was to help, and that is all I have done," unquote. The court plans to issue a written decision by tomorrow morning. We should add the Zonja Mayor special election to fill Blas's vacancy is set for this weekend. Reporting for Guam's News Network, I'm Adriana Cotero.
In regional news, we go over now to the CNMI, where our Tomas Manglotnya is standing by. Tomas.
Good morning, Bree and Chris. Here's the latest news in the Northern Marianas. As the CNMI focuses on the executive and legislative processes of each branch, KUM spoke with a third branch of government, the CNMI Judiciary, on how they're impacted by the coronavirus crisis. Here's Director of Courts, Sonia Camacho. Take a listen.
About the recent furloughs and the budget cuts. We know that the fiscal summit was recently held with all three branches of government there and representatives from the private sector. How have the courts specifically been impacted by the recent furloughs? How many staff had to be let go, and what do those numbers look like for the judiciary right now?
Well, initially, we were informed in beginning of the year that all the branches of government would have to take a proportionate cut, and so the initial cut was at 28%. As COVID-19 containment measures took effect, and I think the revenue projections started to dip. As we all know, the economy shut down, and in early April, our allotments took a 48% cut, and so it's a huge cut to our operations. What that did for us is initially we imposed austerity days for our staff, and so the court was closed every Friday. And then because of the huge cut that came in April, we went to workforce reductions. So the workforce reductions meant non-renewal of contracts for some staff. Furlough, 12-month furlough for some.
Also, new update from the FEMA Deputy Supervisor, Defense Coordinating Officer, and Mayor of Saipan. Lab technicians, swab kits, and more PPEs from South Korea arrived on Saipan last Sunday. And in more COVID-19 news from Saipan, in conformance with Governor Ralph Torres' extended public health emergency declaration, and for ensuring protocols for ensuring social distancing, the Nutrition Assistance Program will be distributing benefits through drive-through service again at their office in Aslito from 8 a.m. to 3 p.m. from June 1st to June 15th. And an update from the Department of Corrections, Commissioner of Corrections, Wally Villagomez, announced on Wednesday that all employees, officers, and inmates from the CNMI Department of Corrections have all tested negative for COVID-19. According to Commissioner Villagomez, DOC employees took initiative by registering for testing when the community-based testing initiative began operations in the CNMI. As part of its ongoing initiative to reach out to vulnerable and at-risk communities, the Commonwealth Healthcare Corporation collaborated with DOC to collect specimens from over 100 inmates and staff for testing. Again, responding to the concerns raised by media partners and community members, the Commissioner assures that the CNMI Department of Corrections is 100% COVID-19 free. And here are the latest numbers from the Commonwealth Healthcare Corporation on COVID-19's count here in the CNMI. The cumulative number of confirmed COVID-19 cases remains at 22, with 2 deaths and 13 recoveries. The number of persons released from quarantine as of May 27th is 472. And now the CNMI has reached over 5,000 people tested through the community-based testing initiative. On Saipan, that number is 4,640 people tested. On Tinian, 234. And on Rhoda, 326. To bring Chris, that's the latest here in the Northern Marianas.
Thanks, Tomas. In national news, the number of people who have died from coronavirus in the United States hit 99,000, but a new model often cited by the White House has lowered its death projections. and more cities, counties, and states are opening up again for business. Elise Preston reports.
Churches, pools, drive-in theaters, and in-person shopping is back in California. But at this mall in Ontario, California, shoppers are finding many stores still shuttered and long lines outside open ones.
I didn't think it was going to be that empty. So, none of the stores were open?
On New York's Long Island, some businesses are now able to offer in-store or curbside pickups.
We're hoping to just salvage the rest of the season.
And Nevada's governor has announced most businesses can reopen Friday, and casinos are on track to open next week. University of Washington researchers now say 11,000 fewer Americans will die by August. That projection is down to about 132,000. Still, 27 states reported increases in new coronavirus cases Tuesday compared to 2 weeks ago. New CDC guidelines warn COVID-19 antibody tests are wrong nearly half the time and should not be used to determine if someone is immune to the coronavirus. And a new Associated Press poll with the nonpartisan objective research organization finds half of Americans are skeptical about a COVID-19 vaccine, and only about half say they will get one.
I think there's an opportunity for policymakers and health communicators to convey kind of what's going into building this vaccine, how solid are the data to make sure that it's safe, so that when it's available, we can kind of have pre-addressed some of those concerns.
The Trump administration has a goal of having 300 million doses of a vaccine by January. Elise Preston, CBS News, New York.
7-1 report. Right now, your health should be your priority, but taking care of your finances will help alleviate some of the tension and stress you might be feeling. Knowing that your money issues are taken care of will also allow you to focus more on your well-being. Here are a few steps to help you move forward. Reach out to your bank and our creditors before things get out of hand. The sooner you reach out, the better. There are so many resources out there to help you through this difficult time. Get familiar with what those are and what is available to you, whether it's support during unemployment, deferred payment plans, or other emergency benefits. Learn about which programs are for you. And if you don't have a budget, now is a good time to put one together. If you're facing a significant reduction in income due to the COVID-19 pandemic, then track your expenses carefully and build an emergency budget. If you already have one, consider reviewing it to see if you can pare it down and reduce your expenses further. And finally, stay safe and be aware of scams. That's your Banking 671 report, sponsored by the Bank of Guam and Coast 360.
Thank you very much, Sabrina. Yep, bills, it sounds like the doctor, the longer you put it off, the worse it gets. So, yeah, call your bills thing. 6:43, good morning. Morning, Bree.
Good morning.
As always, a great big, giant, huge show for you. We got Attorney Tom Fisher to talk about his double pay lawsuit coming up. Senator Joe San Augustine flying blind with a budget. We'll talk with him about the budget, and then there's also public hearings tomorrow on the
double pay bills, the
right.
speakers, vice speakers, and Senator San Augustine's bills.
Right, so 3 double pay.
They're at all different times too. I think the first one is at 9, I think 9, 10, 6, something like that. There's 4. One of them is I think it's a vice speaker's bill on the governor's executive order or something like that. But yeah, I can pull it up.
It's going to be a double pay Friday, basically. A dine-in double pay Friday. Wow, dine-in starting tomorrow.
I know.
Are we going to breakfast or?
We'll be here at work.
Yeah, we will.
Send us your pictures, though.
Please do. Yeah, if you are. I wonder. I still feel like a lot of people are remaining cautious. So, like we saw with the opening of the shopping centers, I was able to go get a haircut. People not really showing up. I mean, yeah, they're showing up to Ross. Mm-hmm. But as far as the malls go,
were people wearing masks when you went?
Yeah, you got to wear a mask.
Well, there's people who don't wear masks sometimes. So.
Yeah, but to get into the malls, I went to GPO the other day and they did a temperature check and sprayed me with some hand sanitizer. Then I just touched everything because I had clean hands. I'm just just spray me, start touching the person. Yeah, right. What? We're clean. Yeah, so I wonder.
I haven't been to the mall yet, so.
Well, I just went to get the haircut, and then I got somebody food at the food court.
Who's that somebody?
I got Sabrina food at the. Funny story before we move on to our first guest of the day. I went to get a haircut, and there was a couple people in front of me running late in my appointment. And I thought, I've been taking so long. Let me just grab Bree something from the food court because she's probably so hungry. So I grabbed you something from the food court. I got back. I was like, here's your lunch. And then I ordered my lunch, which was, a little up there. Some nice Thai food. Yeah, a little bougie Thai papaya salad. I didn't know it was a problem. But after she was like, oh, wow, you got me food court chow and you got yourself papaya salad with, wow, golden shrimp, and what else you got there? Wow.
Not to interject, but I will have your back on this. Welcome to the last 21 years of my life. When you share a show with this wonderful creature over here, and you have your work wife, you hear about little things like that all the time.
I take my food seriously, okay?
I was just
I'll have your back on that. You really, really do. I buy her Skittles. She's like, why isn't it M&M's? I buy her Snickers. I want a Butterfinger, right?
Oh, God. Okay, so I get it. Next time I'll just get Thai, all right? 646. Hey, reopenings? Yes, lots of them. They're starting dine-in. Also, individual exercise classes.
Yeah.
I think we need more guidance on the guidance.
Well, we did try to get Ricky Hernandez on to kind of help guide us through the guidance. But he has some meetings that he has to attend to. So
right, yeah, investor meetings. We heard.
Right. Well, let me see, because I was like, so is a CrossFit gym a gym?
It's a box. Yeah. That's what I was talking to some of my CrossFit because I'm an avid CrossFitter. Pre-COVID. Anyway, so they were like, yeah, we're not a gym, we're a box, and I was like, there we go. Huh? You're in.
No, but you do have some gyms that offer like yoga.
Yeah, so that's why I mean.
Are they open, or some gyms that offer CrossFit? Well, Custom does.
Yeah, I don't know.
You know what I mean? So what do you mean? Is it a gym or is it not a gym?
I guess it might be a good morning to call 311, Bree. That'll be fun. What do you think?
Oh yeah, we should
call 311 and heads
up. Do we
get
charged though if you call 311?
Not from the landline.
Only on.
There was something with one of the telecom companies where they were charging it, but I think that they took care of it because it's supposed to be a free call.
Mm-hmm.
648. We talk about reopenings. One of the big reopening news that came out earlier this week: indoor masses will resume this weekend on Sunday. So, of course, we want to bring Father Paul onto the show to talk about that. Good morning, Father Paul.
Good morning, Chris. Good morning, Sabrina.
Happy day.
So how are we prepping for the indoor masses this weekend? I was just thinking in my mind, are we doing like disinfecting and maybe measuring off to adhere to social distancing? What kind of prep work is going into the rollout and the resumption of indoor masses?
Well, we're doing all of the above. We've given the pastors flexibility on how to prep their churches, but we made some recommendations. When I say we, I'm talking about the Liturgical Commission. We made some recommendations to the pastors and perhaps having one entrance so that nobody sneaks in the side door. Perhaps getting one of those infrared thermometers so that we could take people's temperatures. Putting signs with pictures, because some people do a lot of people do better with signs and pictures rather than reading directions. Cording off every other pew so that there's that distancing aspect of it. Allowing households to sit together in one pew. When I say households, I mean those people who have been together during this whole time of quarantine.
Right.
But also measuring off 6 feet within the pews itself. So if a household sits together in one pew, then the next one to sit there will be at the 6 foot marker. That's if there is one. So there might not be any room for anybody else. Making sure that the pastors provide ample hand sanitizers at the entrances of the churches. Make sure that there's no water in the holy water font. And also putting some, like the stores do on the floors, marking off the 6 feet
right.
distance, so that people can separate themselves as they line up for communion. But the one thing that we also want to make sure that people understand that, we're still in P Court 2, so the Sunday dispensation is still in effect. So people are a little bit wary or are scared to go out of their houses or even go indoors into the church. They still can attend Mass through live stream, and they can still, if the pastor allows it, if the pastor puts outside speakers or a canopy outside of the church, they can still attend Mass outside.
But it's like a first come, first serve.
Oh, yes, definitely. And we need, one of the things, and I hope the people listening, if you're an usher in your parishes, the ushers will be one of the most important ministries that we will need for this in order for this indoor Mass to be very successful.
Polly, with the pews, right? So if we're sitting in this pew, the pew behind is, it's really a couple feet away. So how is the layout for social distancing doing? With the
every other pew is going to be blocked off.
Okay.
So if you're sitting in one pew, the person sitting behind you is going to be a pew away from you.
So Polly, in your case, Jigo, how many people can you fit, you think, in the church adhering to all the social distancing measures?
There's a joke. Everybody asks me how many people can we say, well, are you talking about Chamorros or are you talking about Filipinos? It all depends. How many skinny people can you fit? There's a lot of people, but it really all depends. So
100 Filipinos and 25 Chamorros.
We need a blessing.
I would say maybe comfortably we can fit probably around 800.
Wow. That's a big church, though, right? Yeah.
It's pretty well. You have to remember that we have side rooms.
Correct.
First floor and second floor, so we have quite a bit of room. But all pastors need to also realize that even though there is no more than 50% capacity, pastors need to realize that they're probably going to only fit around 30%. Because of the social distancing.
Right. And Polly, is this island-wide? Are we looking at every village church having masses, or because I haven't seen the schedule?
That's a good question. We've also allowed the pastors to decide whether they would like to. Can they pull this off? Can they have social distancing in their churches? Some parishes have chosen to postpone the indoor masses until later, so that they can really prepare their churches for the indoor masses. So not all. To answer your question, not all parishes.
Okay.
But it is open to all if you can pull it off.
And Polly, so the governor is now going to allow gatherings of up to 25 people. Is that starting on Monday?
I think everything starts on Friday.
Right. So I'm thinking in my mind that's going to affect the funerals, right? Yeah. Which have been so tough for so many people. Still 25. It's a lot better than less than 10. So how are we retooling that to allow for bigger crowds at the funeral while still adhering to all of the social distancing?
Well, as far as churches are concerned, we're adhering to the no more than 50% rule. Because a Mass is a Mass, whether it's a Sunday Mass, whether it's a funeral Mass, whether it's a wedding Mass.
Right.
So it's inside the church.
Correct.
The pastors have been told to follow the guidelines, and the guidelines right now is no more than 50% capacity. Always knowing that you might not even reach that, because of the social distancing. And again, pastors are reminded that if you're going to have a funeral Mass, and the protocol calls for only funeral Masses being allowed. There'll be no viewing of the body. The body must be viewed over at the family home or at the funeral home, and then be processed over to the church just for the Mass and strictly for the Mass. So
that's not going to change.
That's not going to change.
Okay. But what will change is now you could have the funeral Mass and you could have 50% capacity in the church.
Correct.
Okay.
Correct.
Which means that, it's great. People are going to be able to go and give their chintuli and go and pay their respects. And I mean, at least attend the mass. So
attend the mass. There will, and again, when I say strictly a mass, that means that there will be no eulogy. So you don't process the body over to the church and then have a eulogy. When you process the body to the church, we go, we receive the body at the entrance, and then process in, and then the mass starts. Mm-hmm. No eulogy, no little, as we call it in liturgy, no little commercials on the side. We just strictly have the mass and then the final commendation, and then we process over to the cemetery for burial.
What are the faithful saying, Polly? It's been a very eventful week for the church.
Well, we're all cautiously optimistic. We don't, judging by the parking lot experience, the parking lot masses, we don't really expect the church to even be up to 50% because people are still afraid. The brave ones will come into the church, and again, we advise people who have a persistent cough or have flu-like symptoms to please do not come. If you have any comorbidities such as diabetes, a heart problem, and even the elderly, of course it's their choice to come in, but we suggest that they just don't, because the Sunday dispensation is still in effect. But a lot of them want to receive the Blessed Sacrament, so that's why they would come. Mm-hmm. And a lot of them miss receiving communion.
You said there are people that are concerned and might keep them away from going to church, but what about priests? Are any of them concerned? Maybe they're older or may have pre-existing health conditions, or even some of the ushers, altar servers, lectors.
That is also another good question. We have informed the ministers, even including the priests. If you're concerned about your health problem, then we suggest that you don't serve. And so that leaves a lot of our priests are are elderly or they have comorbidities. So it's going to be a challenging time. But most especially with the ministers. A choir is a very important what do you call it? We're still debating over the use of the choir inside the church, because when you sing, mm-hmm. you project your voices, and when you project all these air what do you call those?
Aerosolized droplets.
Droplets, yeah. Those droplets will go out, and so if you don't have anything to stop it, you can continue to spread the virus. So it's very important in how we handle the choir part.
I think they could sing with a mask, Polly. I did a couple performances with the mask, and if they're mic'd up, it'll carry.
Yep. And I think
that's going to be a fugu moment, Polly, when you guys open indoor mass, and then it's like, boom, here comes the choir. Oh my God.
Stay away from the choir.
Now, when that choir starts singing, though, that's when everyone's going to be all goosebumped out, and they'll be like, oh yeah.
Oh yeah, I mean, well, over at GIGO, we use a choir loft, which doesn't really mean anything, because when you project your voice, even though the 6 feet distancing doesn't really count, because when you project your voice, you have that powerful, your droplets go out like a cannon, and then down into the people below. So
correct.
We're going to have to really train music ministers on their PPEs. And they're going to have to project their voices a lot louder.
Face shield.
Because of the mask. Yeah.
So that's something we're still working on. We might not have the choir on Sunday.
I wouldn't recommend it. Maybe one cantor. And then they need to be far away from the congregation.
Right.
So that they don't, blow any droplets out there into the congregation.
All right. What about all the other things that you guys had mitigated because of the risk of the spread of COVID? How are we? Could you go down the line from anointing the sick to all the things that you had either put on hold or?
Okay.
Yeah.
Yeah.
How are those changing with these new easing of restrictions?
Well, the visitations to the sick, to the non-COVID persons, especially to the homes, are allowed, but they need to continually don their masks, put on their PPEs. For baptisms, because there is a special protocol. In the big churches, usually we have like 5 or 6 baptisms at one time. Now we can only allow one baptism at a time, only because we are going to be using bottled water for each individual. So they need to be done one at a time inside the church. And of course, the 50% capacity needs to be followed and all the other mandatory protocols. The weddings is going to be a little bit different. We can still have wedding masses, but the rings will be placed in front of the couple so that the priest doesn't hand the ring or the coins off to the couple. They will pick up the rings themselves and they will minister their vows to each other by themselves. What other things are there? The one thing that the pastors need to, have been delegated to do now by the Archbishop is to confirm their confirmands in their own parishes, and of course they need to make sure that they do it in a very, very cautious way, still adhering to the protocols for mass inside the church. Sometimes if they would like to have a mass in a parking lot, that's up to them. It's the flexibility is there for them to use. And then First Holy Communion, of course, again, we need to plan that carefully so that the protocols are still followed. So we can do all the sacraments. The only thing that we cannot do, and we met with Guam Memorial Hospital, because Guam Memorial Hospital is the designated COVID hospital in Guam. The priest cannot go directly to the emergency room if they're called. The priest cannot go directly into the patient rooms on their own. Everything needs to be done through the nurse in charge, and everything needs to be requested by the family. And as long as the medical team, especially the nurse in charge, gives us the okay to go into the hospital, that would be the only time that we can go in. GRMC has already allowed us to go into the hospital, but again, we also need to be very cautious and make sure we have our PPEs in order to anoint. And to anoint oils, we don't use our hands, our bare hands. We will use cotton swabs to anoint, and then put the cotton with the oil, the sacred oil, in a bag, which is to be burned later on because they're sacred. We don't want to just throw them in a trash can.
Yeah.
Well, that's good, Polly. I'm glad to hear that you guys have worked around all the requirements. Indoor mass. What is the message going to be this Sunday as far as and I don't want you to give away too much because I know you do great homilies, but what message are you going to be bringing to your flock?
Well, this Sunday, so appropriately is Pentecost Sunday, is the birthday of the church, and it's such a wonderful homecoming for the church to actually go into the building, because we are, the church is not the building, the people are the church. And it's wonderful that the church will be allowed to go into its own building and to remind ourselves that when Christ, founded the church here on earth, he said that not even the gates of hell will prevail against this church. So not even COVID-19 will prevail against this church. This church will survive. This is a kingdom that will have no end, and we need to remember that. And whatever happens, whatever challenges that life throws at us, we cannot be defeated by them. But we need to always raise up our eyes to heaven and always know that God is always there, even in the darkness, and that He will guide us. He will lead us to the light. That is the message.
Amen.
Amen.
Thank you, Polly. Anything else you want to add in closing here?
I attended a wonderful ceremony for the graduates for class of 2020 yesterday. It was put on by Alicia Callie and George Guerrero. And I'd just like to make a wonderful congratulations to our class of 2020, that even though in these dark times and this, bittersweet moment in their lives, again, to look up to the heavens and always know that there are so many possibilities out there. Don't let this one experience of not being able to have a quote-unquote normal graduation ceremony let you down, especially those who are graduating from high school. But there are so many possibilities out there. You just need to have faith and then allow yourself to be open to whatever God plans for you in your life, and take whatever experience that you received during this time of quarantine and to look for all the silver linings in it. and allow those silver linings, allow what you have learned outside of the classroom during these quarantine times to move you forward into the future. So congratulations again to the class of 2020.
Viva class of 2020! Viva! Hey, in the immortal words of Michael Jackson, you are not alone. I mean, all over the world, right, Paulie? So there's definitely a lot of company.
We are never alone.
Thank you so much, Father Paul, and I know you're excited for this weekend. So really want to just wish you the best and.
Thank you, and thank you so much for having me on the air.
Always, anytime. Our pleasure. Okay, Father. Wash your hands.
Gets him every time.
Right. 706. Let's keep it on the phones. He's doing good work out there in the community. Want to bring on my buddy Ed Wengu from the Micronesian Resource Center, who actually is out there assisting with the testing and passport services for the homeless. So I know you're able to pull over and give us a few minutes of your time. Ed, thank you so much for that. First of all, we'll start with what's it like this morning assisting the homeless? What's it look like out there?
Good morning, Chris and Sabrina.
Good morning.
Well, the weather is beautiful out here. We're just getting set up here to assist at the garage down in Suman. This is day 3 of Passport to Services with Department of Public Health and the Guam Homeless Coalition. So we should be getting underway here very soon.
Okay. Now you guys have something else going on today, right? Later on, a virtual town hall meeting?
Yeah, so in partnership with the FSM Association of Guam, we've put together what's called a virtual village meeting to kind of conform to everything that's going online, since we can't really reach. We're really used to going out, foot to the ground, boots to the ground, meeting with our people and giving information. But now we've all gone to virtual, or we're starting up virtual meetings. This is going to be session 3 of our virtual village meetings, and these are conversations, presentations of information, for our Micronesian brothers and sisters, but it's open to anybody that will join in on the virtual village.
And I'm reading your release here, and it says that although your program primarily caters to those from the FAS, the office has seen an uptick of calls from Guam residents of all backgrounds seeking assistance. What are these people who are asking for help, Ed, from you guys? What are they all saying?
Everyone is just trying to seek information, the correct information, and not rumors. So we, as a team, we do our best to gather that information from different agencies, and our biggest initiative right now is translating and getting that information out to the masses. So we translate information from different agencies into Chuukese, Pohnpeian, and Kosraean, and then we put them out either through our social media, or we send it out to departments for their use to connect with their customers or clients.
Can you send us those videos? We'd like to share those.
Yeah.
Oh yeah, no problem.
Yeah.
Please do. That'd be great.
The other thing I wanted to ask about are some of those questions related to like unemployment?
Right. That's the biggest question. Is when is the unemployment application, or people just show up and ask for assistance with the unemployment application, not knowing that it's still not ready.
Yeah, it's frustrating, Ed. I mean, working in the media, family, friends, they call me all the time asking what's new with the unemployment, and sadly, nothing's new. There's no application, there's no, and the more we hear about it, the more frustrating it is. We had the labor director on, and he was talking about when we do get the application, the turnaround time, at least initially, according to the guidelines that they have from the U.S. Department of Labor, you turn in your application, they're talking a 21-day review period, which is essentially another month. Man. And so these people who are asking about this unemployment, how hard up are they, Ed?
Well, for the most part, our clients have seemed pretty patient. I mean, they express their frustrations, but they know that it's all just a waiting game right now, and there's not much they can do about it except voice their vent to us and we're pretty much there for them to vent to.
Well, we did have the Department of Labor Director Dave Delasole. He was on the radio yesterday when he was giving us that information. But one thing he said was that they are reaching out to businesses to train them on the online application process once it goes live, some of these employers can help their employees fill out the application. So I'm wondering, have you received, or has anyone from DOL reached out to you and your organization to perhaps train your people?
Not our organization directly. We did get someone from DOL reach out to us earlier during the lockdown and this them processing this application, but we haven't heard back from them since, even with follow-up. But the FSM Consulate General Office will be a site to assist our community members, those without internet access or computers, get online and go through the process of the unemployment application when it does come out.
I'm sorry, so the FSM Consul General's Office is going to have a computer available?
Right. They will have a few computers set up to assist with the application.
Where? At our office?
According to the office itself, it'll be at their Building D at the FSM Consulate.
Okay.
Well,
that's here in Harmon.
Yeah, keep us in the loop on that, Ed, and when that happens, we'll be sure to get the info out there.
Well, we definitely will do.
How important has translation been for you guys helping public health with these outreach testings and the efforts that you're helping with this morning? Is the language barrier a reality? And I mean, you guys are there to provide that resource, right?
Right. So it's been very crucial for us to get these translations out as quickly as possible. So our team at the Resource Center has been working really hard. Our biggest challenge is sometimes some words don't translate over real well. So what is one word in English comes out to be two sentences in the various languages in the island. So our team has been working as quick as possible to get the information out to DPHSS during these testing and to really have people informed on how to care for their respiratory problems at home and just how to quarantine or isolate themselves and not to really limit the spread of COVID.
What have you heard, Ed, about positives in the FAS community?
Positives in
COVID-19, with any of the groups that you represent and work with?
Well, a lot of the information coming back is people are actually spending even more time with their family, so that's always a good thing. Parents have more time with their kids, supervision. So that's one of the more positive outcomes.
Right. Yeah. Silver linings, right?
I wanted to ask, are you helping or in contact with the students over at the University of Guam that have been prevented to leave the university because flights? I don't know if the flights have resumed yet for them to return back to the FAS and FSM. And I know that we helped them with the 7-day supermarket to provide them with bottled water. Have you been, your organization been helping?
So our organization, actually that's an initiative that the Consul General Office has been doing a really good job at, is providing support to the FSM students up at UOG that have been stranded, I guess. Our organization reaches out to different community members, individuals that have been stranded here on Guam. So we've been providing support through weekly meals as much as we can. But regarding the students at UOG, that's an initiative that the Consul General has been doing really good at.
All right. Well, what can people expect then from today's virtual oversight hearing? And I didn't see the actual time for the oversight hearing virtual town hall.
Yeah, so Virtual Village today is scheduled for 4 o'clock, and people can join us live on Facebook at 4 p.m. Our Facebook is Micronesian Resource Center or Mr. Kosquam.
Mm-hmm. And how many people are you anticipating to be? It's on Facebook or Zoom?
It's a Zoom.
Zoom, yeah.
Via live, streamed live on Facebook.
On Facebook, yeah. So how many people are you anticipating?
So our first session, these are really informal conversations that we have with the people in our community, just so we can get their information out there.
Mm-hmm.
Our first session, we had about up to 100 viewers, and we're hoping today, with the help of the media getting the word out there, we hope to get more people coming on. And at the end of the live anyways, these videos are live sessions are saved, and for them to watch again and again and get really get access to the information.
So how do people who want to participate in the Zoom, what do they need to do? Because you have to send out the invite?
Yes, so if for people who would like to participate in the Zoom, the link will be on our Facebook to access the Zoom meeting.
Okay.
And Ed, are you guys taking advantage of this captive audience? I mean, it seems like everybody is just tuning in to all the different content on social media. So you're seeing an increase in numbers as far as getting your messages out?
Yes, definitely. That's another positive outcome as more and more people are becoming aware of the services and information that we provide at the resource center.
Right. So you're seeing new people.
New people. Right. Yep.
That's good.
All right. That's good. Anything in closing you want to add, Ed? Do you want to give a message out to people? I know you're out there assisting with the testing homeless today. I think EPOW Pavilion, right?
Correct.
Yeah. So what do you want to say out there?
Well, I just want to remind everyone that these are really challenging times, and if we just respect one another, we'll get through this time together.
All right. Thank you so much, Ed.
Yeah. Hey, take it easy. Wash your hands, Kay.
Will do. Thank
okay. And keep us posted. Ed also did a One Micronesia podcast with our victorious Falan. Is that up already?
Jace?
That is. In fact, it is. It's on YouTube right now. You guys can watch a really fascinating discussion. And if you thought Ed was, highly entertaining, obviously the Manila organization and the Micronesia Resource Center, they are all about service 24/7.
Yeah. Right.
They are on the streets. They're in that super cool van. Have you guys ever been inside the van?
Yeah.
They have that resource van. It's awesome. But Ed talked a lot about what they're doing, a lot about with the outreach, as you just discussed, with the Micronesia community locally, what they're doing to give back. So that's actually streaming right now on YouTube, and we're actually going to be running that live at 11 a.m. right here on our Facebook page. Really good discussion, and Vic did a great job interviewing.
Right, yeah, that's definitely one of our flagship pieces of content. There's a One Micronesia podcast.
I know it was on a little bit of a hiatus because of COVID, but now we're back on track, and so you can expect to see more of Vic's podcast, One Micronesia, on our social media platforms.
Awesome.
And it really is just an outstanding show in sharing, I guess, the cultures of the different islands.
Right. I want to, because I know we were talking about the reopening of extra individual, or what was it?
Reopening
of the fitness, Pilates, yoga,
and dance and CrossFit.
Okay. One of my buddies in the industry had texted me their comment. I don't know what do you think of this? I think the whole gym thing is about ensuring the fitness activity is instructor led, and this allows for the activity to be supervised to ensure greater social distancing, no one sharing equipment, and equipment is being cleaned and sanitized after every class, versus just having people move from machine to machine at quote normal gyms without ensuring things are cleaned and sanitized. So maybe that's what they meant. I don't know. We are awaiting further guidance.
Right.
We're tracking further guidance.
Right. I know there's, according to Crystal, no weight rooms, because I was trying to get more clarification, and she just said
there goes my bench
no
press,
weight
bro.
rooms.
Okay. Well, and speaking of our online resources,
sorry, Jason, no weight rooms.
Oh, yeah. Clearly, that's a priority for me, right? Everybody always says, like, I've got a string hanging out of my shirt, and like, oh man, that's just your arm. But We did a story in the last couple of days about, what's going on, with the gyms and the exercise places. And for those of you wondering, the gyms themselves, I mean, these guys are spraying down, they're wiping, they're spraying, and, pending the opening. I mean, those guys, every square millimeter of equipment they have is being sanitized. And, we got a really good interview with Dr. Ryan Claris from Custom, and then our friend Mikey Skrull from Paradise. But that's streaming right now. If you guys have any questions, or you guys are in the comments right now, want to know what's up with the gyms, go check out that story because it'll answer a lot of your questions.
Right. And I want to say that even before COVID, we were sanitizing.
Oh, yeah.
Oh, yeah.
I mean, how many times after a class you get that spray and you wipe down your kettlebell,
your bike,
seat, your bike, your handlebar.
rower.
All right, 7:21. We'll take a little break, come back with more of the KUAM News Takeover, Guam's favorite containing COVID. Good morning.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
Be healthy. Be informed with ITD.
We hope that you and your loved ones are safe and healthy during the COVID-19 pandemic. It has been a challenging time for all, but now, more than ever, our cancer patients and caregivers need us. Although we are apart, we stand united in the fight against cancer. The American Cancer Society Guam is excited to announce our first virtual Relay for Life. Join us on Saturday, June 27th at 6:30 p.m. on KUAM TV 8, as well as on I-94 FM and streaming on KUAM News digital platforms. Cancer does not stop, and neither can we. On June 27th, let's celebrate together and fight cancer. Visit cancer.org/GU to find out how you can participate in the 2020 Virtual Relay for Life Guam.
Be healthy. Be informed with ITD.
graduating seniors. Join us by showing your class pride in the celebration caravan you deserve through the island's major thoroughfares. KUAM and its partners want to recognize your accomplishments and help celebrate this pivotal moment in your lives. To participate, email promotions@kuam.com and let's get this show on the road. Special thanks to ABC Stores Guam and The Dungeon.
Be healthy. Be informed with ITD.
The 7:29. Good morning. It's containing COVID, the K-Wave News Takeover, Guam's favorite. Morning, Sabrina.
Good morning.
Let's get right to it and get the Budget and Finance Chair, Senator Joseph Augustine, onto the show. Good morning, Senator.
Good morning. Hey, good morning, Chris, and good morning, Sabrina.
Good morning.
So I understand there was a little back and forth here that played out over K-Wave News between you and the BBMR head, Lester Carlson.
I think, Chris, there was maybe an appearance of maybe a lack of communication between my staff and him, because he's the staff of the governor, and I'll leave it at that. But we have been in communication with the administration after that, before that interview he had, and after my interview, I just needed to clear that part up. It's not anything against my cousin Lester. You know, it's just a matter of, hey, come on. call my staff, your staff. The OFB and BB Mart, that's where the communication's at.
Right.
Then we bring it up to the level of where I'm at and where the governor's at, and then we come to terms with exactly what we need to discuss.
So where are we at?
Huh?
So where are we at with this budget?
Well, we have our numbers. I can't reveal that yet, but the governor's office has already reached out to us. The governor's office now, I'm not talking about BBMR. The governor's office has reached out, and we'll be meeting with them and taking a look at exactly what numbers they have so that we can move forward. But, we're not in the blind. We already know. We pretty much see the CRE report. We have questions of it. We have doubts of it, but, that's what everybody will have with anything. Everybody always has a different interpretation of things until there's clarity when heads, minds meet. And we'll be meeting with them. We'll be moving forward. And when I believe some of the folks were actually thinking that when we did do some of the budget hearings, we need to understand the budget hearings we did were for non-line agencies. And I'm going to continue moving forward with non-line agencies first until the line agency, which is Guadalupe, are ready to go to bat. Then we'll start discussing their budgets.
What's it been like, Senator, doing these budget hearings with no accurate revenue numbers for the next fiscal year?
No. What we're doing on the budget hearings, Chris, is we're looking at what are the bare bones they need, and they've stated what they've asked for, but they've also understand that because of the shortfall, they expect to get cuts. They're just hoping they get as close to what they're asking for, because most of the budgets that have been proposed, other than DOE, who's normally over $100 million more, pretty much could be a status quo or maybe just a little bit less because of what's going on in Guam. Now, at the same token, we got to also predict it or take a look at how now there seems to be allowing a lot of business to start opening up. So, remember, we have to trend this. We're only in June. Got to see how it works in this month of June into July. And we're going to have a budget set. And you've heard me say that, number one, the budget they proposed pre-pandemic, it's not there anymore. I honestly believe they actually acknowledge that also because for a fact, Chris and Sabrina, that the stimulus money we're getting today is going to end soon, okay? And some folks have told me, Senator, you're not 100% on the stimulus ending in December. Yeah, you're right. I'm 99% because there's some grants and some stimulus that will extend beyond, maybe even as far as 2023. But majority of that will end in December, unless there's another stimulus that comes through, and then there's more money. Mm-hmm. But at the end of the day, I have to eye what the business community are feeling, and right now, we wrote a letter to GHRA, Guam Chamber of Commerce, asking them if you can give us some numbers, because as we look at the CRE, and then we have to take a look at also what's going on in the business, how they're feeling, what is the impact, and then merge it together and say, okay, where are we at truly? What can we visualize? And you have to understand that whenever you're doing a budget, it's all a projection. Mm-hmm. And we hope to get as close as we can, but we're going to be more conservative this year than we were last year. Last year we were, remember earlier this year we were tracking over 33 million, then it dipped. Then now, you've heard the recent one, it says 4.9 million short. Okay, June's going to come up also, and if it starts to grow and get back into the black, then it's the stimulus that drives that train. Mm-hmm. Not unless we see a resurgence in the businesses, that restaurants and people are starting to go in, and it's always got to be life before money, okay? But the business got to open up, or else there won't be any life in those businesses. So I'm really hoping that people will not only just, sure, I like going to Ross, but go fun to the other stores also, because they're eager to see.
They're Malago.
Yeah, you go to GPO. Everybody's around the block on Ross. The other stores are also open. Mm-hmm. Take a look at it, because sure, Ross got the best deal. We got to admit that. But everybody else has good deals also. And I honestly, the businesses they're willing to offer deals. You just got to come and visit.
Mm-hmm. So we had this pre-COVID, this $1 billion budget. We're in the thick of things with COVID. So where are we? What is the new budget revenue projection? We're still trying to figure that out, and we have until August 31st to adopt a budget for next fiscal year.
That's correct. Sabrina, as you mentioned, is that $1 billion. We have to understand that even with our 803, we were always working with $1 billion.
Mm-hmm.
But because you got to pay your bonds and stuff like that. You have your payables. But technically, the administration was actually asking for like 822 or 23. So right now we're looking at it that we're not at that point. We're not even close to that, and we're actually eyeing that it'll be even less than what the budget is this year. So, but we're going to work out the numbers, and if when I say we're not there yet at 823, if we're down to let's say 800, or let's say even 790, for example, that's a shave off from what pre-pandemic is about what $43 million. And if you shave up 43, then we have to take into account the offsetting on based on what the businesses are going to be producing. And that's what I'm saying is, see, even though we got into August 31st, and some folks may think that you're cutting it short. Yeah, we're cutting it short, but we got to be very careful so that when I do present the budget, I will be meeting with all the oversight chairs and explain to them and showing them what is tracking, what exists, and then we move from there. I mean, just recently, we got the fiscal note on the double pay on all 4 bills, and wow, it's not as bad as I thought it would be. And if you remember, Chris and Sabrina, the governor said on the double pay it should cost $36 million if it was double pay and differential. Well, worst case scenario right now, I'm looking at my bill, 361 only says $18 million. So. Wow, so half of her projection was more differential than there is for double pay. So, that's what we have to work with.
All right. So are you guys going to get a revised budget, a revised spending plan?
No, I don't believe they already stated that they won't give us a revised budget, but we're going to be able to tell them that you're not going to get what you asked for. Let's start with that first, Sabrina. Mm-hmm. You asked for $1 billion, 822 or 23. I'm trying to remember is it 823 or not. But whatever you asked for, that's not something that we're going to agree with. Mm-hmm. And I believe they really understand that. And it's very realistically, it's not possible. But to say it's a lot less, I mean, not $100 million less, but a lot less than 823, and with that note, I think it's safer to say that's where we're going, and that's where I believe the administration believes where we need to get, because we're not going to shoot for the stars and end up finding out that, gosh, we don't even have fuel for the rocket to shoot for the stars.
Mm-hmm. So you met with the governor last week. The story came out over the past few days, and so there's another meeting today.
Yeah, well, I'll be meeting with the governor today, and we're gonna, kind of like come to terms exactly the direction we're gonna go, and then we'll move from there. And then you'll start seeing the numbers will start to probably, more than likely, it'll probably sneak out somewhere. Okay, but I won't be able to reveal it yet until we start doing more of the budget, and you start seeing when we go into session in June. I honestly believe that the administration will be, if we do have a committee of the whole, they'll show up and they'll start saying exactly the information, start providing us the information we need. So that other senators can calm down, let's take a look at it, and let's measure from that.
Mm-hmm. Okay.
Go for it, Chris.
Well, Senator,
I'm ready for you.
Yeah, so
I'm up early.
When we talk to all the business people, and Esther talks to the business people, I mean, it's doom and gloom, right? So I know you're waiting for the numbers, but I don't think it's rocket science. You talk about a rocket ship. I don't even think we're going to be able to get off the ground if you listen to what the business people are saying. So what about furloughs? Senator, we've heard the governor drop the F word a few times in the press conferences. Are we going to be so broke that furloughs are going to be a real part of the conversation?
Well, I look at it this way. Before we even consider any furlough, let's take first the other side of, if not a furlough, well, how about we freeze all hirings? What a furlough should? That's something I don't even want to entertain until we take a look at where we need to cut. You know, hiring, travel, and so forth. And just go down the line and let's see where we can trim, where we're at today, and see how much savings. I mean, we have to be realistic. Do we need to keep hiring people today and tomorrow and everything?
How about yesterday? Do we need to keep hiring people yesterday for agencies that are non-essential and filling positions that, I mean, you know, where are you guys at on this, Senator? I mean, we're trying to be fiscally responsible, but we got, you know, the administration hiring a director for an agency that's 4 people that we consolidated to save money. They're hiring a deputy for an agency that hasn't had a deputy in I mean, over a decade.
And exactly what you're stating, Chris, is that's a very good example of something that the administration needs to take a look at and start. You know, I use the word realignment or reconstruct the government and go on the line agencies and determine exactly where you need to, how you need to merge them, and move forward from there. Mm-hmm. Because there are, you know, and you've seen the duplication of efforts. I mean. Was that, like you mentioned, they hired 1 director or deputy director for 4, and then they put them somewhere else other than what they need, and then why don't we just merge them back together? Why don't we just start consolidating efforts until everything is more closer to back to normal? But, you know, we're never going to get to back to normal. But we can move forward from there.
I just feel like if we're talking about, you know, out of one side of our mouth saying that, oh, if we pay this or that, we're going to have to furlough people, then the other side of our mouth, we're like, no, it's okay. We're going to hire political hires and you come and work for, but we're going to go put you in the quarantine.
Well, and exactly. But see, at the same token, as they're saying, on one physical note, like Bill 361 was the bill I introduced, they're saying I threatened the possible furlough. Well, on the other bills, they said, well, we can use the CARES funding. Well, I can use the CARES funding for this one, and I can understand because my bill says it's until whenever the emergency is over. Well, they can introduce an amendment that says, well, why don't we end it similar to what Senator Nelson brought up? Is that why don't we end it after when we get to PCOR 2? There's got to be a determination of when the full impact of the emergency has really subsided to the point where you can say, okay, we're not at this full emergency, because like right now we're not, because why? We're opening up. We're opening up businesses. So that means we're still at an emergency, but we're not at the state where we were in March. Mm-hmm. So then this is what we need to find out now. Okay, at what point is the emergency not where we're at the lockdown point? We're not anymore, so then let's go backwards in time and says, okay, when is that date when we're not at the lockdown point? And I believe that it could be as early as before June. That's definitely. It could be sometime in May. And if we measure that, the 18 million they're saying that it's going to cost to pay the double pay for all that have to come in. Just measure it from there, and then we move on. And I think that's pretty reasonable, and I believe the employers will understand that. And what I just don't understand is that you have agencies opening up, and most of them are was that you come in this week, or you come in today, tomorrow you come in. Well, why don't you just shift the hours of the day? You know, if because the people at Walmart are there, well, why don't we open then at 7? Why don't we close at 7? You know what I mean? And then have the people shift in so that you have the maximum amount of people, you know, that you're allowed to be in your agency, but you have everybody that can go there. I mean, not everybody is free up to 5. They have to take leave to go to the government agency. Well, if they're open just a little bit later, shifts, it's all management. Chris and Serena, it's all management.
Are we talking about double pay? Because now you guys just kind of lost me here.
Yeah.
Are we talking about double pay? We're still
So what did you think of, Senator, what did you think of the Klitsky commander's testimony that he submitted?
Well, you know, I haven't really gone over it, I've been going over the other notes I've been getting from everybody else, and well, you know, I got to admit it. Senator Krinsky, I like his thoughts, but hypothetically, let's think about it. Okay, yeah, we shouldn't be entitled to them, but this law on the typhoon of emergency, because remember, pandemic's the new one. He had no problem with it. They got double paid during those times. Okay, now it's pandemic. They shouldn't get. Oh wow. Why had to change your heart? But you know what? I take his comments and everything. Like I will have to see everybody else, and we'll measure from that, because you know, that's how it has to work. You know, he can't trump everybody else. What do you think?
Well, it is what it is. That's what I think.
Exactly, it is what it is. Thank you, Chris. I appreciate that statement.
Yeah, you know, I wanted to go back to the budget, and we were talking about how BBMR wasn't planning to provide a revised budget to the legislature. But what about the
go ahead.
But what about the Office of Finance and Budget? Do you guys have a revenue projection or a revenue outlook that you can share and let us know what exactly that is?
Well, you know what? What I'm going to do is I'm going to contact Steve, my director, and ask him to see what he can provide or what he's willing to provide publicly, because I don't want to. We're going to be in communication with downtown, and I want to make sure that we have a clear understanding of where we're heading with them, and it'll be on them now to convince me on, and the Office of Finance and Budget, where they're heading and where we can agree to a certain amount, because like I said, the $1 billion or $823 million is not going to happen.
Have they conceded to that in your meeting last week? Have they come and said that, yeah, you're right, we're not gonna this $1 billion revenue projection is not gonna happen?
Well, you know what? We just looking at the CRE, that's already telling us that if you're almost $5 million short from your projected of 803, how can you expect to even reach 823? I'm not going to say they've conceded to it, but they're willing to sit down and talk.
Well, when do you reach a point, Senator, where you just put your foot down and say, hey, give us the damn numbers, that's it, or no budget? No budget for you, no numbers, no budget.
Well, we got to look at it this way, Chris. Like I said, we're going over, and we'll be hearings. We'll have public hearings on the non-line agencies, and as we move down the 9-line agencies, and once we feel that this is where they need to be, just to continue to provide the public service, and then we go to the line agencies and we start looking at what they generally would need. Because you got to remember, Chris, and you've heard this in Sabrina before, is that if you didn't need anybody, if you never hired anybody for the past 2-3 years, what's the urgency today now? Public service is still being provided. We got to make sure public safety is first, health, and then education. Everything else is follow. Hurry up.
You forgot
so I'm sorry, why won't they give a revised budget? I mean, what's the reason why? I mean,
isn't that the Bureau of Budget Management Research's job, maybe?
Well, his job is to come up with a budget to provide to the governor and a recommendation to the governor. You know, it's like the Office of Finance and Budget. They'll come up with what they project and what they believe is what the budget should be. Then I sit down with them and we go over it. We just basically hash through it and cover all the, make sure all the I's are dotted and the T's are crossed, and we move on from there. And then we say, okay, Governor, BBMR, your budget folks, let's sit down. This is the numbers we're looking at. What do you have? And if we're close, then we can say, okay, we got to get closer, because we're going to be more conservative than they will be. And then we'll just go from there. And at the end of the day, we're the one that has to pass the Budget Act. And,
it sounds like we're playing a game of poker. What you got? I got this. Boom, Trump.
Well,
I mean, I don't think we can continue to afford to play some games here.
It's not really. It's a numbers game, like you're saying. But
we're playing games with the people's money. It's like,
exactly.
Come on, let's just.
And I definitely will not do that. I'm looking at the numbers and I'm saying, this is what we see. Unless you can show me something else.
Okay, so Senator, then show us your cards. What are we talking about? What is OFB's revenue projection?
I don't have it with me right now, Sabrina. And
organize Steve and let you know.
I'm like, let me get through the day, and then we'll let you know. Okay, because
fair enough. You're gonna be meeting with the governor, or who is it? The governor or Lester today? Oh, okay.
If anybody's truly gonna meet with BBMR and any of the financial people, it'll be OFB.
Steve.
And then if they want to call me into the meeting, great, I'll come to the meeting. Mm-hmm. But I'll be meeting with the governor and the lieutenant governor and saying, we're going to come to terms exactly what direction we need to ensure, number one, public service being provided. Number two, we're not going to be talking about furloughs. I know that. I won't be. And if they start that, the conversation will end. Because I want to know first where the cuts are going to be at in the government of Guam. Mm-hmm. You know what I mean? Before you start terminating folks, which takes a 90-day rule,
so you're saying, are you saying that based on the numbers that you know of, that Steve has probably provided to you, I would think that he would have to provide those revenues to you. So based on the numbers that you know that the legislature has, there should be cuts. There's gonna have to be cuts.
Yes, but not furlough.
Right. Okay.
Are we talking
like reduced hours?
Are we talking Trump tax cut level cuts, Senator, or deeper than that?
Well, Chris and Sabrina, let's start with number one. In every budget, you have warm bodies and nobody yet. You know what I'm saying? The vacancies, and that's all part of your package of your budget. So when you take a look at that, then you start to say, where can we afford to cut? Before you start saying, it's like looking at the two of you. Before I say, well, let's cut Chris. No, let's cut Sabrina. No, why don't we reduce the time we're on the air? That's cost there. Why don't we reduce the time the cameraman's on? Chris, instead of you come in every other day. This is where the administration comes in and their financial management. That's their personal management.
Yeah, but I mean the financial management. They're hiring political hires. That's the I don't.
Wasn't there a budget where deputy directors were cut?
Yeah, but then they were like, "Oh, it's in or you can't. It's infringing on the governor's authority." But I feel like if that happened and you want to look good, we'll say, "Yeah, I know I have the authority to hire deputies, but I'm not going to because we want to save money."
Well, we looked at it this way: you, for example, you can hire anyone you want, but provided there's funding, right? So that's where we come into play, where we say, okay, we're not gonna infringe on the separation of powers. You do whatever you believe or what you know legally you have the right to do, the authority to do. Do it, provided there's funding. And I'm not saying we did that last year. We didn't fund the deputies. They took it out of height, and that's what we did in the past. When we're not, there's certain positions we're gonna fund. Now, if you want to. Not hire 2 or 3 people because you're going to fund another position. And that's on you. It's not on us because if we reduce the funding, then that's it is what it is.
Man, Senator, you're getting killed in our comments here. Everyone's saying, "Oh, he's in re-election mode."
No, it has nothing to do with re-election. They need to stop that because you know what? I'm calling it straight out. And if you don't like it, well, come down to the legislature and find out yourself. Because you wanted me to call. I called. I have no problem. Nestor came down. We did an interview. We can go through this and we can show you. Even if it was an election year, what are they going to say? Oh, he's prepping up for that. Have a nice day. Well, we're going to do what we need to do and present what we need to present as soon as we can present it to the people of Guam. I have no problem doing that. I've never hidden from it. I just don't answer the phone. But if you came down to my office, Chris, and you said, "Senator, I need to talk to you," sure, let's go for it. Every time you've come down, I've never ignored you, Chris, and you know that.
Does the governor know what OFB's revenue projection is or outlook is? The number?
No, that's why we're meeting today.
Okay, so that's why you won't tell me?
Why don't you have like a Zoom meeting, Senator, where it's all out in the open with and then with the meeting you're going to have with the governor, is it just going to be you, or are you bringing anybody else?
No, it's staff. We're going to meet and we're going to talk about where we can, where we're at or where they're at, where we're at, and then we're going to move forward on that one, and then things are going to come out in the open very soon. It won't be that long.
But not today. They're going to be behind closed doors today.
I said at the end of the day.
It's like you and me talking before we do the interview, right? Chris? We talk first before what we're going to discuss so that we understand where we're both going.
So is there an independent projection that we're going to see from the Office of Finance and Budget?
I think they usually do.
Yeah. Well, I'll tell you what, Senator Therese Talai did request for a projection from OSB, and we're preparing that already.
Okay.
Mm-hmm. So that's why I'm saying it's going to come out real soon. It's just we're just making sure that as much information as we can get, we're putting it together so we can say this is what we're projecting. I mean, she asked for a projection for 2020. We're going to give her that. We're going to give her that projection. What we believe it will go, and end it there. And then we're going to take a look, and like I said, I'll be meeting with the oversight chairs of all the committees and saying, okay, this is what we're looking at. And exactly what's been said on the radio is that everybody's talking about, a lot of the special funds are not reaching their point. That's true. There's no doubt about that. But we need to always remind ourselves that on majority of occasion, whenever the special funds don't meet their target, the general fund funds that, fills that void. But it just all depends on where we're at on everything, because liquid fuel tax, wow, at one point senators wanted to reduce it, and then now that it's not tracking, you don't hear a true bark no more, because why? That's the source of paying for road projects. What are you doing? You want to cut, you don't want to charge 4 cents for gas, but I want the road fixed. Hello? Mm-hmm. Take a look. Reduce the GRT to 4%. You're not in business. What are you paying? There's a deferment rate. There's a lot of things that are in place. I think it's a matter of maybe we'll sit down and we'll go over all of them, and then you can see it, and then you can throw in like exactly what you said, Chris. Well, why don't we just stop this? Well, why don't we? Right, well, there's a role we play in the legislation. There's a role the governor plays. There's 3 branches of government. Everyone has a role. Let's play the role. Let's do our part, and then we work down. And then when we go down that road, we go down that road. But pre-election, no, there's nothing to do with running for office. I would do this in a non-election year.
Well, it's your
job.
I've
always been straight up.
Right, yeah. Okay, Senator.
All right, cool.
Okay.
Right.
Yeah, keep us posted.
Oh, yes, don't worry. We'll get, we're not hide. There's nothing to hide from the people of Guam. People of Guam just got to be patient.
All right.
And I know they've been patient. They've been patient for the stimulus. They've been patient with unemployment.
They've been patient waiting in line.
Yeah.
Yes, and that's very unfortunate. I wish they would open more sites. Why is there only one?
Because this is a federally funded program.
Yes, the product is federally funded, but the personnel passing it out are not federally funded.
Right, yeah.
You could have spread it out. You could have 4 villages issuing at the same time.
We're going to talk about that coming up, Senator. You might want to listen. Okay.
You have a nice day.
Thank you. Wash your hands.
Oh, of course. I'll put on my mask.
There you go. See you.
Bye.
7:58. Re-election mode. I think it was clear when he said, the people of Guam just need to be patient. And then he was like, but I know they've been patient. Hey, let's keep it going here. We're KUAM FM and Agani Guam. Want to bring on Holly from the Guam Women's Chamber to catch up on some of the... Good morning, Holly.
Hi, Holly. Good morning, Chris. Good morning, Sabrina. How are you guys doing?
We're doing pretty good. Just wanted to talk about some of the reopenings, and I'm wondering if you could maybe shed a little light on some of the guidance that's going to be in play when we do these reopenings tomorrow morning.
Absolutely. Yeah, so we have a lot of reopenings coming out. We do have an official guidance coming out later today, which we will be publishing on our website, and that's GuamWomen'sChamber.com. So we definitely will have that available.
Is this the guidance for Guam Women's, or is this the guidance as a member of the Economic Recovery Group?
This is just guidance for the public, and for businesses to open.
Okay.
So what will be, So what will be actually published to give more firm guidelines on and requirements especially for the dine-in restaurants, will be released today. So I know there was some guidelines released. There's a little bit more on the requirements that'll be available, so that'll be really wonderful for people, because I know restaurants are excited to be opening. People are excited to be going out. There's graduations happening. You know what I mean? Like, people want to enjoy. So it's going to be really exciting. So we're really excited about all the reopenings that are going on in this gradual kind of release of restrictions.
This is you guys going to do a FAQ like you did last time?
Yeah, we absolutely could. We try to keep that conversation going. If we don't release a PowerPoint FAQ, then we've been doing virtual town hall FAQs as well, and getting the key players on board so they can answer those questions, and just really being able to be someone who's communicating the message, right? Both chambers are doing that right now, and I think it's exciting to be a part of that, to see, okay, what kind of questions are coming in from the business owners? How can we relay that communication and just, get the information or resources out there to help people open up and, just to streamline that entire process.
What can you tell us about the, maybe more clarity on what types of fitness services are going to be allowed to open? Because I think I get what the governor was trying to say, but what kind of threw it off for a lot of people was, she said, dancing, yoga, Pilates, but not gyms. So.
Right. I think that's a little bit, okay, so that's, So to clarify that, from what I know is, you can have fitness classes, but it's not just the open areas or the open spaces. So if they have a fitness class, they may go to that, because that's a lot easier to maintain, spacing, cleaning before and after classes, that sort of thing. But as far as just having open gyms where people can go in and work out at their own leisure, she doesn't want that open at this point in time, because that's a little bit harder to control.
So if a gym offers yoga, if a gym offers CrossFit, they can open, but they just people can't go in and for the class.
For those specific classes.
But if they have like a treadmill class, then you could go on the treadmill. So basically,
I imagine if they had, you could do
like
that,
a bike class, cycling.
Yeah, exactly. Because you can clean the equipment before and after.
Right.
You can maintain the number of people in there for the duration of the time, etc. Right. So it's easier to control.
So I guess the way to get around it would be to have a open gym individual workout class.
I guess, I guess that's one way of looking at it. So.
No, I mean, the businesses obviously are getting creative with how they're going to reopen, and so, and talking with all
classes, I've seen really creative things out there, like, okay, this is 6 feet apart, we're spacing you guys out, we're doing it outside where there's more airflow, and, they're having people sign in just in case for contact tracing. I mean, they are being really creative, and I think that's just a part of, something we're seeing coming out of this, is how creative and innovative business owners are and people are in general.
What about...
So if I have a personal trainer and I want to go to Paradise, right, to work out with my personal trainer, that would be allowed?
I believe so. I believe that was mentioned, personal training as well, because it's the same thing. You can control it, you can schedule it, you can have a certain amount of people, so on those kind of things, just as long as it's not just open, anyone coming in at their leisure, that sort of thing.
Real quick, guys, we're KUAM-FM, Agatna, Guam. Good morning to our viewers on KUAM TV 11. It's the KUAM News Takeover containing COVID here on I-94, and on the line we have Holly Rustic from the Guam Women's Chamber, and she's also a member of the governor's recovery panel of advisors. What about jiu-jitsu, Holly? That's a class atmosphere, and we're getting a lot of comments about that.
I don't know specifically for that one. I do know that close contact sports or close contact classes were not being as far as promoted, even in the regular guidelines for gyms. That was something even business members had put forth in their guidelines, that they would restrict those classes at this point in time. So unfortunately, that's just, it's too close contact. So under my understanding, those things are not, very close contact classes or sports are not enabled yet or allowed, or the gradual rollout will happen at some point, but
right.
I don't believe that at this point in time.
But people are working on those guidelines, because I know, for example, I have my son, he trains here in Guam, but he also trains when we go on vacation in Vegas, and so the gym in Vegas is actually getting ready to reopen. The jiu-jitsu gym.
People definitely, people can get ready, they can get guidelines prepared, and that's what we're encouraging all businesses to do. You know, if you're not open yet and you don't feel like you're on the list, let's say, still put your guidelines forward, you know, and that's, you know, the chambers, we're both accepting those if you want to send those to us or to public health. I mean, get your name out there, get your guidelines prepared. If you need help preparing those, contact us. You know, don't feel like just because your name isn't there that you might not be considered. Definitely, you know, advocate for yourself, and that's what we're here to help advocate for you as well, for business owners. We can't guarantee, of course, that, you know, you're going to be open, you know, the next time it comes up next week or whenever, you know, the next release is, but at least you're on the table and there's consideration going on, and there might be discussion on that to figure out, okay, well, maybe these guidelines could be tweaked in this way to make it, you know, a little bit more, you know, just acceptable, that sort of thing.
Right, yeah.
Mm-hmm.
What about in the 24 hours since the last 24 hours? Have there been any developments at all with the daycares and the child care centers?
Right. So we're working really hard. Guam Women's Chamber of Commerce, of course, you know, we look at this as a four-pronged item, and it's very important to us. We're passionate about it because women are definitely, you know, disproportional in as far as owning daycares and needing daycares and working at daycares, right? So as far as we have a lot of business owners that are women, and they are putting forward their guidelines. They are being very, you know, assertive, and they're out there. They're very proactive, which is great. We've been working with the Guam, the Guam Child Care Association, and it's just been really great. But we also see, you know, of course, a lot of our members are parents and they need daycare. And then we have, you know, members that could be employees at daycare. And then, of course, other business owners, like you heard, of course, Jaylene Kent. I heard Dr. Kent on the radio yesterday, and she had mentioned, of course, she owns a business and one of her employees needs childcare, right? So there's like this four-pronged, you know, kind of approach to looking at childcare. It's really an integral part of our economy. So it's really important, and we're passionate about it. We have been continuing to communicate with public health. Right now, we have forwarded everything that we have in guidelines, and we are in discussion with public health as far as what that looks like. And, you know, what we're hearing from public health at this point in time is they need more time. They're a little bit cautious, especially because of the cluster of the 11 last week that were positive. And, you know, the thing is kids, CDC guidelines even say under 2 and under don't wear masks. Like, that's not good for your development. And you can't really social distance kids, so they are more vulnerable age group. You know, so there is that to consider. Absolutely. Of course, we're sensitive about our children, too. You know, so it is a very complicated kind of issue, and we are, like, looking at other case studies of states that are opening, even countries, right, that are opening daycares. And, yeah, I mean, I think it's something that they are definitely considering, but right now they just really need to make sure that, you know, the numbers are where they need to be and everything like that. So I don't think it's a case of if they're going to open, it's when, right? So we're advocating for that. We're definitely trying to have better communication as far as between public health and the businesses. I was really happy to hear yesterday when they said, when public health said, you can go into your businesses now and start preparing. So that's what businesses were waiting for. You know, they're like, okay, we understand we might not be able to open up tomorrow, but we need to get ready. So it's a part of having that communication. And I think we're definitely going to continue to advocate for that. So at least there's that continued conversation so the businesses can be prepared and the parents, right?
But it sounded like when we talked with public health yesterday that they're, I want to say not even at the beginning of the process to look at what it takes. They were saying, like, we're still coming up with, there's no federal guidelines really, so we're kind of on the drawing board still.
Well, there are CDC guidelines, and we have talked to them since yesterday. So that was a good thing, too, that we were able to continue that conversation. And from what we're hearing from public health is, okay, we've got your guidelines, and we got the Child Care Association guidelines. We have all the guidelines now. We're seeing that there's other CDC out there guidelines and recommendations. We're reviewing those. However, we are still, this population is still a high-risk population. So we need to really look at this in more detail. We need more time, so that's what we're hearing currently. It's not that it's completely off the burner or anything like that, but it's just like, okay, we still need more time to look at this and to see how this is going to affect our population, especially as we're seeing these little cluster groups, and they're saying that could be a really high-risk area because they're clusters of kids not wearing masks and not social distancing. So that's just, what one of their concerns.
So what are the I guess the documents that you've seen, the guidelines, the proposals that some of these daycare facilities that have submitted? Are we looking at like you can open for toddlers, but just not the infant room, or you know what I mean?
No, there's not that. Yeah, I know what you're saying. It's more about opening in smaller groups. Actually, the clusters can be a bad thing and they can be a good thing, right?
Mm-hmm.
So they're looking at clusters actually being a good thing from the child care perspective. As far as we can contain, I think what I've seen is up to 12 kids, and I think that would depend on the age group. But those kids would always be in the same room, and they would always be together, and they wouldn't intermingle with the other groups in other rooms. So they wouldn't have like co-playground or co-eating, that sort of thing. They would have, it's staggered, so the kids are eating in the room, that sort of thing. So they actually keep these little clusters together, and then that way it's easier, to contact trace as well, right? So you're having, So, and there are, like, of course, like I said, 2 and under, not wearing masks, and you can't really social distance younger kids. And they're not saying that they would do that. They're saying more hygiene, cleaning, and daycare is, they've always had strict standards anyways. This goes back to the conversation even about like hair salons and, that sort of thing opening up. Is like, well, they've already had very strict controls as far as their cleaning processes. So, but of course it would be more increased in the kids washing their hands every hour and, the staff wearing masks, that sort of thing. So it's, it's kind of a gradual. Some daycares too would have limited amount of kids. And of course that would be, how many rooms do they have and how many kids can they have per room, right? So it would, sorry, go ahead.
I wanted to follow up on the CARES Act funding that I guess the congressman has been mentioning, and even I guess it's $6.4 million. It's been available since April, and a portion of that funding actually would go to these daycare providers to sanitize and disinfect, prepare their facilities. Do you know anything on the distribution of those funds?
It's something that we're really looking into still. We're asking, and as soon as I get that information, of course, we can share with you guys. I mean, because that's really, we're wanting to know exactly how that'll be laid out too. And I believe it's all with public health right now. So that's something we're following up with public health on. And so I mean, that'll be good for just, of course, the daycares to know what that is. I've kind of heard it in reference to block grant, but I'm not sure how that rolls out because there's already block grant. So that's something definitely that we're interested in finding out as well.
Right. I know public health said that they had been making payments as part of this block grant based on enrollment. But I guess there wasn't just that clarity on, but what about the funding for these daycares in general for the disinfecting, the PPEs and all of that? So.
Exactly. So that's my understanding as well, as there's block grant funds already earmarked. So what is this part of that paying that out, or how is that? So it's definitely something we're asking about as well. And I'm sure we'll get that information soon. So it's just, once again, public health is really busy, but they're doing their best to communicate with us. They've got a lot going on. I know they have the whole discussion on SNAP today. They have a lot of different programs they're rolling out, and they really have been proactive with communicating with us as best as they can, right? So it is just that following up and us having those discussions.
Holly, going back to the dine-in, so you said the guidance is coming out today. Is that what you said?
Yeah.
Okay.
Yeah.
Well, public health issued their guidance yesterday, but this is a separate one from...
I believe there's more detailed requirements.
Yeah, because I think people want to go out to eat, but we don't know what the hell is going to happen, and I don't want to go in blind because I want to know what the guidelines are so I can ensure that the business is adhering to them, right?
Yeah, exactly. So what I heard is that we will have more of those detailed requirements today that we can definitely share on our website, like I said, and we'll be sending out to our members as well. But in general, it's the 50%, right? And we'll get more of the detailed requirements. So that's exciting. If you're looking forward to going out and enjoying a dinner outside your home.
Right. Okay, Holly. Well, thank you for your time, and we got your number. Great resource. So we're gonna use that number frequently.
Yeah, okay. I appreciate you guys also spreading the word and getting the message out there and helping with the communication. I think it's really, it's important, right? So that we're just going through this process together and figuring it out. It's kind of a dance as we go along, but I think we're being
heads up, I'm not the best dancer, just so everybody knows. Watch your toes.
That's right. Get your dance class going.
Yeah, I got to go to dance class. That's what it is. Thank you, Holly.
Thanks, Holly.
Thanks so much.
Wash your hands.
Yep.
Okay. 8:14. We're going to take a break, come back, do our anthems, do our news, and then we're also going to hear from Dr. Vince Duenas from the FHB Take Care Family Clinics to find out how their response to the COVID-19 pandemic has gone, And also find out a little bit more about the payment of these Tier 2 clinics. That's coming up here on the KUAM News Takeover, Guam's favorite, Containing COVID. Good morning.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
Be healthy. Be informed with ITD.
Graduating seniors. Join us by showing your class pride in the celebration caravan you deserve through the island's major thoroughfares. KUAM and its partners want to recognize your accomplishments and help celebrate this pivotal moment in your lives. To participate, email promotions@kuam.com and let's get this show on the road. Special thanks to ABC Stores Guam and The Dungeon. We hope that you and your loved ones are safe and healthy during the COVID-19 pandemic. It has been a challenging time for all, but now, more than ever, our cancer patients and caregivers need us. Although we are apart, we stand united in the fight against cancer. The American Cancer Society Guam is excited to announce our first virtual Relay for Life. Join us on Saturday, June 27th at 6:30 p.m. on KUAM TV 8, as well as on I-94 FM and streaming on KUAM News digital platforms. Cancer does not stop, and neither can we. On June 27th, let's celebrate together and fight cancer. Visit cancer.org/GU to find out how you can participate in the 2020 Virtual Relay for Life Guam.
Kantai mantunat nyagi toru ilugar para ion ra para I gloria abiba islasen para ion ra para I gloria abiba islasen para Gitodu I tempo I paz para ita dan gini langit na bendition contra I peligro na fan sa fuham Deus protege Islam contra I peligro na fan sa fuham Deus protege Islam
Good morning. It's the KUAM News Takeover of Guam's favorite, and it's all proudly brought to you by IT&E, Ambrose Inc., Coast 360, Calvo Enterprises, and the Bank of Guam at 822. Good morning to our viewers on KUAM TV 11. There's also a stream, KUAM.com, and on the KUAM News app, and last but not least, on the Edward R. Murrow Award-winning social media networks of KUAM. Good morning to our Facebook Live viewers. Good morning. 8:21 again, and as we do in the 6 o'clock and the 8 o'clock hour, we take a dive into the day's COVID-19 headlines from the KUAM News team. Sabrina Salas-Matanani, good morning.
Off today, everybody. Here's what's making island news. A total of 141 samples were tested at various labs around the island, and one turned up positive. Additionally, there was one new probable case from GRMC, bringing the total count of COVID cases on Guam to 171, with 5 deaths and 143 released from isolation. Governor Lilian Guerrero made some major announcements during a briefing Wednesday afternoon. Starting tomorrow, 8 a.m., you will once again be able to sit in a restaurant and enjoy a meal, but only half the room will be allowed in at any time. Salad bars, buffets, and self-service operations of any kind remain prohibited. Outdoor dining is allowed and recommended. Food courts, bars, and taverns will still be closed. Places of worship and nonprofit organizations will also be opened, but again with 50% occupancy. Private physical activities will be allowed, such as Pilates, yoga, dance, and CrossFit under limited occupancy, but gyms will still be closed. Public gatherings at beaches and public parks will be allowed. There will be a limit, though, of 25 people for that barbecue. The governor also announced she's relaxing restrictions effective on the 1st of July for visitors, specifically from Japan, South Korea, and Taiwan, meaning she's lifting the 14-day mandatory quarantine upon arrival. During the briefing, Ernesto Lecanto asked about the island's tourism and economy.
Governor, I just wanted to get back to the issue of the July 1st reopening of tourism. Have you had a chance to speak with GVB and former Governor Gutierrez and discuss how they're going to market Guam? What sort of things are they going to highlight, for example, that Guam is relatively safe, that sort of thing?
Yes, actually, I've been in close communication with the team at GVB. And in fact, we just met yesterday and worked through the decision to prepare our industry to open on July 1st based on the importance, Nestor, to make sure that we give them a heads up so that they can prepare. And they are going to be working very closely with their market contacts, and they're going to be looking at how do we attract and again incentivize and persuade the market to come. Of course, they're very mindful of the fact that at the beginning, we're not going to have a huge amount of tourists coming in because, again, it is a mindset, right? Oh, is this place safe? We are going to market that Guam is safe, and we are going to market that we continue putting in measures to continue making it a safe place. That's one of the things, especially in light of the fact, Nestor, that with our low numbers in COVID cases, our low fatality of COVID cases, and in fact, in light of the fact that we also were just as aggressive and just as proactive in putting in these measures as South Korea, Japan, and Taiwan did, and as a result, they have been successful in containing the coronavirus also. So we are going to continue using our measures to keep our place safe, and we will be able, I think, to bring back our industry. And also, I'm very appreciative of GVB and the task force that former Governor Gutierrez has put forward in terms of close communication and close marketing so that we can, again, bring our tourists back to Guam.
And the second question, Governor, is are we starting to see a shifting of your focus, your administration's focus on the looming economic crisis, if you will? We've asked several people in the government about, the revenue projections for GovGuam. There's no clear-cut answer on that, but the conventional wisdom is that we're in for a little bit of pain next fiscal year. Can you discuss a little bit about that? What are what is your visibility in terms of government's revenues and the government's ability to fully operate?
I think we continue to focus, Nestor, on making sure our people are safe and making sure our people are healthy and making sure that we don't increase our fatalities. That's foremost. And we've never really shifted our focus from that. We are very concerned, of course, of our economy. We are very concerned about the potential losses in revenues. We are also very concerned about the losses in jobs and, of course, businesses that are not able to maybe start off, rebuild again, but we are making sure that we are helping them in every way we can through financial means, through resources, through training, and so forth. So we are focusing a lot of our effort and a lot of our energies with the help of the business community and with the help of the whole community, actually, with help of financials, to rebuild again our economy.
The governor, meanwhile, is also expected to extend her public health emergency declaration, which is set to expire May 30th for another 30 days. Senator Jose Pito Chulayi, meanwhile, reacts to the governor's announcement that Guam will be opening to visitors from Japan, Taiwan, and South Korea without requiring testing for visitors. Quote, without testing visitors first for COVID-19 before they travel to Guam, we are opening ourselves up to a greater risk of a second wave and another lockdown. This does not do any good to our viability as a tourism destination, nor does it protect the health and safety of our residents. Just like we make sure air travelers are not carrying weapons or explosives before they travel, we need to make sure they are not carrying COVID-19 and inadvertently spreading harm to others. This must be done by doing tests. It's common sense, end quote. The signed contract with Hotel Santa Fe to be used as a quarantine facility for the government is being reviewed by Adelude. Over the weekend, the more than 60 passengers that were forced into quarantine there were moved to another quarantine hotel because of concerns. Calls to GSA to get answers as to what happened have gone unanswered. So KUAM asked for an explanation during the governor's briefing Wednesday.
Can you clarify what was the problem with Hotel Santa Fe? Because we're hearing that it didn't meet standards. We've tried to get a hold of the chief procurement officer who oversees the procurement for the government of Guam normally. Claudia Akfaji. However, we haven't got a response. We heard there were issues with it, though, and we know that people quarantined there were moved to another facility. So I guess my questions are, how is that possible if you guys conduct a walkthrough prior to signing anything? And is that contract still in effect? And is anyone going to be held accountable for that?
I'm going to just say that I don't handle the procurement of the facilities for those isolation or quarantine. Our role at the department is just to look at the facility and ensure that there is some type of negative air pressure, ensure that there's containment for infection control and so forth. And that's our role in regards to what we're doing at our the department. So I will diverge that question to perhaps the governor. Maybe she can elaborate more on that.
It's a matter of having a contract, and services that are to be delivered are delivered. And so there was not adherence, but the services that they said that was going to happen didn't happen. And so it was to the point where we wanted to make sure that our people are, in a much better facility.
Joint Mayor Jesse Blas could be released to third-party custodians on strict pre-sentence conditions. U.S. District Court Chief Judge Frances Tydinko Gatewood is inclined to release him, but says she wants to sleep on it before making a decision. Adriana Cotero reports.
The court stating to Blas, quote, "If I were to release you, you better not screw up. I rarely release people. This is an important case to the United States government, to the community, and to yourself," unquote. Earlier this year, former Zonyia Mayor Jesse Blas pled guilty to extortion charges for allowing drug trafficking through Zonyia mailboxes. Sentencing has been pushed to August. Defense counsel Joseph Rosano argues the Hagåtña detention facility is unsuitable and unsanitary to conduct attorney-client discussions. Additionally, there are concerns of improper medical treatment. The government strongly opposes Blas's release. This afternoon, the court heard arguments from both parties. When on a virtual live tour of the lockup, questioned the potential third-party custodians, being his 24-year-old son, Bo Blas, and his girlfriend of 15 months, Stacy Coletta, who reside in Blas's residence. The court also heard testimony from federal marshals, Department of Correction officers, Blas's doctors, and Blas himself. During the teleconference hearing, Blas spoke out despite his attorney's attempt to cut him off. Blas stating, quote, "Your Honor, I would not even attempt to contact anyone, whether they are named or not named. I never had any interest to contact them. I have pled my wrongs. I have accepted my responsibility. I always thought as a mayor my duty was to help, and that is all I have done," unquote. The court plans to issue a written decision by tomorrow morning. We should add the Zonyia Mayor special election to fill Blas's vacancy is set for this weekend. Reporting for Guam's News Network, I'm Adriana.
Of people who've died from coronavirus in the U.S. hit 99,000, but a new model often cited by the White House has lowered its death projections, and more cities, counties, and states are opening up again for business. Elise Preston reports.
Churches, pools, drive-in theaters, and in-person shopping is back in California. But at this mall in Ontario, California, shoppers are finding many stores still shuttered and long lines outside open ones.
I didn't think it was going to be that empty. So, none of the stores were open?
On New York's Long Island, some businesses are now able to offer in-store or curbside pickups.
We're hoping to just salvage the rest of the season.
And Nevada's governor has announced most businesses can reopen Friday, and casinos are on track to open next week. University of Washington researchers now say 11,000 fewer Americans will die by August. That projection is down to about 132,000. Still, 27 states reported increases in new coronavirus cases Tuesday compared to 2 weeks ago. New CDC guidelines warn COVID-19 antibody tests are wrong nearly half the time and should not be used to determine if someone is immune to the coronavirus. And a new Associated Press poll with the nonpartisan Objective Research Organization finds half of Americans are skeptical about a COVID-19 vaccine, and only about half say they will get one.
I think there's an opportunity for policymakers and health communicators to convey kind of what's going into building this vaccine, how solid are the data to make sure that it's safe, so that when it's available, we can kind of have pre-addressed some of those concerns.
The Trump administration has a goal of having 300 million doses of a vaccine by January. Elise Preston, CBS News, New York.
Your priority, but taking care of your finances will help alleviate some of the tension and stress you might be feeling. Knowing that your money issues are taken care of will also allow you to focus more on your well-being. Here are some tips to help you move forward. Reach out to your bank and our creditors before things get out of hand. The sooner you reach out, the better. There's so many resources out there to help you through this difficult time. Get familiar with what those resources are and what is available to you. If you don't have a budget, now's a good time to put one together. If you're facing a significant reduction in income due to the COVID-19 pandemic, then track your expenses carefully and build an emergency budget. If you already have a budget, consider reviewing it to see if you can pare it down and reduce your expenses further. And of course, stay safe and be aware of scams. That is your Banking 671 report, sponsored by the Bank of Guam and Coast 360.
All right, thank you very much, Sabrina. 836, the KUAM News Takeover, Guam's favorite I-94. Good morning. It's all proudly brought to you by Cabos Insurance, Ambrose Inc., IT&E, Coast 360, and the Bank of Guam. Let's go to the phones here where we have Dr. Vince Duenas from Take Care and FHP. Good morning, Doctor.
Good morning.
Hey, good morning, Chris, Sabrina. Thanks for having me.
Well, thank you.
Our pleasure. So we've got a regular line open with Dr. Hoa from AMC, of course, and they were designated as one of the Tier 2 clinics that we know that FHP was as well. So we kind of wanted to bring you on, and if you could, maybe, first of all, to talk about how the clinic's response to COVID-19 has gone during this pandemic, if you could, Dr. Duenas.
Yeah, definitely. I think FHP Clinic, when we got the call to respond as a Tier 2 facility, we were quick to rise to the occasion. We had two primary roles as a Tier 2 clinic. Number one was to serve as an alternate testing site and triage facility for COVID directly. And then number two, to serve urgent care cases in order to alleviate burden on both GMH and GRMC. When the island first got the initial cases, it sort of created a panic, and the public, for any symptom related to COVID, quickly flooded the emergency rooms, and the whole Tier 2 model was created in response to that.
And so when that executive order came out, how did it then affect you guys, and what type of service were you? Because you guys were basically deputized to help fight COVID on the front line. So what did that entail?
Yeah, we definitely changed up our entire clinical operation. So that meant clearing up our entire schedules, canceling all non-essential clinic visits in order to help serve the hospital. So in anticipation of a potential surge of COVID-19 patients, we kind of just cleared the schedules and stayed open, waiting to assist in any way possible. At one point, we even talked about converting part of our clinic and our urgent care into a makeshift hospital if we needed to. And at FHP, we really have the capacity to do that. We have a lot of experienced physicians, experienced nurses. A lot of our nurses are emergency room nurses. And again, there was a lot of uncertainty in the beginning, but we were just ready to respond.
Right. And so are you guys still responding as a Tier 2 clinic, or has that designation for you guys been lifted at all?
We still do. We still run a testing facility outside of the clinic, kind of like a drive-through testing site. Public health has taken over a lot of the direct testing, but we still operate in that capacity. Slowly, we are opening up our clinical services to more preventative health and calling our patients back to get checked up. But yeah, we're ready. GMH and GRMC are filled to capacity with non-COVID related illnesses, and I think now is the time where we got to shift our focus back to preventative health and chronic disease, because our island has tons of it. And when we talk about COVID-19 morbidity and mortality, we already know that the top two risk factors for those things are heart disease and diabetes. And I think now's the time, since we've had the outbreak under control, to focus on treating heart disease and diabetes in order to prevent potential complications. And chronic disease is the top killer in the country. COVID has claimed nearly 100,000 lives in the U.S. so far. Heart disease alone killed 600,000 people in the U.S. last year and every year. So if we know that these are the risk factors for complications related to COVID, then I think we need to shift our focus back onto this. And this is where the Tier 2 clinics come in. FDA, AMC, and FHP combined are the largest in healthcare service delivery on the island and in Micronesia. So that's the role we play at this point.
Right. I think you're right. The COVID-19 has not only shown how resilient we are as a community, but it also shows how unhealthy we are. If you're saying that both hospitals are filled to capacity.
Yeah. So chronic disease is something that our island has struggled with prior to COVID, and before COVID hit, we already had a very fragile healthcare system. And I think with the CARES Act funding, and I know they had at least budgeted for some money to go to the clinic, I think this is really the time to fortify our healthcare system as a whole on all levels, from public health to inpatient care at GRMC and GMH to ambulatory care with the private clinics, in anticipation of any outbreaks in the future, and not just COVID, but any other pandemic that might hit our island. And this is a time to just change the entire healthcare landscape for our island.
Did you say that during when you were designated as a Tier 2 clinic, you had to slow down your regular patients, like from coming in? You put everything on hold just to be the Tier 2 clinic?
We did because there was a lot of uncertainty in the beginning. We didn't know if there was going to be a huge outbreak, and we didn't know if we were going to get flooded with urgent care cases. And so all the non-essential visits, people coming in for like medication refills or blood work or just preventative health physicals, we rescheduled and just kept the schedules open, ready to take on any walk-ins.
But this Tier 2 designation, it's going to remain in effect as long as this public health emergency declaration is in effect, correct?
Correct.
Right. And so the governor's indicated that this is, she's likely going to extend it for another 30 days. Are you guys going to, like you said, I don't think there's a lot of people rushing to the clinics at this point, right?
We're starting to see more volume these days. And
for testing?
Not for testing, but just regular follow-up. Yeah. Public health has done a great job with testing. We still see some walk-ins for testing specifically, but I think now that the initial pandemic has been under control, people are feeling more comfortable coming out to the clinics. Mm-hmm. We also have implemented our patients safe when they do come in to get seen. But if we are designated Tier 2 for another month or so, we will adjust as the situation calls for, and we will remain ready to assist in any way we can.
Right. Doc, this is something that we kind of been following a little bit, and we're able to FOIA the email. So we wanted to get you on and present the facts that you guys were called up basically by the governor to assist with the COVID-19 response through the Cures team,
right,
which is led by the surgeon cell state surgeon Dr. Mike Cruz.
Right.
And so what I was able to FOIA was all the correspondence between the governor's office and the Tier 2 clinics. And where we are today is, I'd asked the governor last week, when are these tier 2 clinics going to get paid? Because like you said, obviously you guys were called up. You've provided a service at the direction of the government of Guam with little to no paperwork, apparently.
Right.
What I'm looking at here. And so come to find out that you guys haven't got paid a single penny, and that the government of Guam and the administration is now saying, when I asked the governor, hey, what are we doing about paying these clinics? She said, oh, well, how I work is I need an invoice, and then I would pay him. And so I was like, okay, I took that at face value. But then when we got the FOIAs, we found out that there can't be an invoice, really, because the Cures team is supposed to, per the executive order, come out with SOPs and a whole billing schedule and all that stuff. So that hasn't happened, right? So that has not happened. So basically, you guys are running your operation into the ground, and we're also hearing from AMC that, it's a burden. I mean, you guys are answering the public health emergency call, but let's be real, it costs money, and you can't have an invoice, you can't send a bill until the Cures team creates the framework for that to happen. So how has that been, not getting paid, affected your operation over there at the clinic?
It's been tough. The healthcare industry as a whole has been hit hard by COVID. Not every small business qualified for federal disaster relief, like the Paycheck Protection Program and economic injury disaster loans. And so we have had to make very difficult decisions as an organization. Everything from pay cuts to reduced hours, to even furloughs, unfortunately. These are obviously decisions of last resort and not unique to Guam. This is actually happening all over the United States. And it's discouraging. It's sad because this is a public health emergency, and I think healthcare should be the top priority. I know the governor did budget at one point for the $7 million for the CARES Act funding toward the Tier 2 sites, and I really hope that does come to fruition, because obviously the more money we have, the more resources, physicians, and nurses we have, and that equals better access to care, and better access to care results in better health for the entire island. And I think our staff at FHP and the other Tier 2 clinics do an excellent job. You'd be surprised at how much we can do in the outpatient setting to support what's going on in the hospital. And so, it's been tough. We've been having to be creative, but we had a healthcare shortage of doctors and nurses prior to COVID, and to now be in a position where we potentially are going to have to lose more is concerning.
Right. So have you had to let go of doctors, Dr. Duenas?
Not yet, but I can say that a few physicians have been given notice.
And so I want to go to the emails that we have had. I'm going to read just a passage here from the Book of Legal Counsel. Sorry. So I was reading this email from April 23rd, and I got this FOIA last week, and it's just funny to give a little bit of context. I got this FOIA about the same time that they had the oversight hearing for the procurement of the hotels. And so we had this whole hearing where they were trying to justify paying out these hotels through this emergency superpowers route that they did it. They couldn't tell us anything about it. They claimed executive privilege. And so they used that process to pay these hotels, to pay a couple vendors. But then they totally moved out of that superpowers lane and then went back to the by-the-book procurement process. And so I watched this whole hearing where you had the legal counsel and policy director Carlo Branch not just attempting to answer questions for people, but not answering questions that needed to be answered. And also continuing to justify the way that this emergency purchase was handled.
Yeah.
And so I thought when I want to read this passage to you, and this is a letter that the legal counsel had written to your attorney. So basically, all the clinics have lawyered up, and that's where we're at now, is they're negotiating with the administration to get paid. But again, going back to you guys getting paid, you can't do that because the Cures team hasn't come out with the framework for it. This is a letter from the legal counsel to your attorney, and it says here, we fully support your involvement as a Tier 2 clinic. However, we need more direction from the Physicians Advisory Group, which includes your client or a designated representative. We have not received any indication that any medical facilities, supplies, or providers have been formally directed to act as government entities.
Mm-hmm.
This would have been in the form of a contract for procurement purposes. And as you know, procurement law does not allow for payment of services prior to the execution of an agreement. And I wanted to read that passage from the Book of Legal Counsel because I just couldn't get over how ironic it was that when it came time to pay you guys, obviously you guys did a service. The answer was, oh, we can't pay because there's no contract and we don't have any paperwork. But when it was time to pay the hotels, no contract, no paperwork, no problem. So how does that sit with you guys? I mean, it's got to be a little frustrating.
Yeah, I mean, it's tough, and you know, I hear a lot about the receipts and reimbursement, but I think it extends beyond that. Now, you know, if the Tier 2, first of all, I think the Tier 2 model is an excellent concept, and the Tier 2 clinics, the three of us, again, are the largest healthcare service delivery component on the island. And I don't think the funding needs to be directly related to reimbursement. Now, if you have clinics saying that we took huge losses just from COVID alone, I think the focus should be more on stimulus funding to help support those clinics in order to strengthen the healthcare system as a whole. Because we all are part of a very well-functioning system, and if one component is affected, then everything is put in jeopardy. And so, I mean, with receipts or without receipts, I think the CARES Act funding allows for our government to provide stimulus to people who need it. And clinics and healthcare should be top priority.
What do you make of that passage, though, where it says that the legal counsel writes, we have not received any indication that any medical facility, supplies, or providers have been formally directed to act as government entities. And I spoke with another attorney who's representing one of the clinics, and they said, basically agreed, how could they write that sentence when the executive order did exactly that? The executive order was a formal directive to you guys.
Yeah.
I mean, I just don't understand it. Like, how do you write that when the opposite is true?
Yeah, and again, I don't know. It's tough and to hear stuff like that. And you know, we have a great management team, and I'm not directly involved in any of those administrative or legal discussions. I'm purely just a clinician. But you know, whether or not we were designated a government entity in response to COVID, the bottom line is that clinics are hurting, and we're asking for support, and I think CARES Act funding allows us to get that sort of relief, especially during a public health crisis. Mm-hmm. You know, if this was an attack from another country, you know, our top priority would be defense and national defense and military, but this is a healthcare emergency, and we need to do everything possible to strengthen the healthcare system.
Mm-hmm. Well, you know, we're talking about all these emails. What about, I think the clinics are also on the Governor's Physicians Advisory Group. I think there's representation from AMC, from FHP, from SDA. And so the Physicians Advisory Group, they talk with the governor every week. I don't see why this has not been brought to the table, or has it? Instead of dealing with emails, what's being discussed face to face?
Right.
And why isn't there any resolution when these clinics are part of the Physicians Advisory Group? It makes no sense.
Yeah, I agree. And there's a lot of focus on very specific things like testing capacity. There's a lot of focus on ventilator capacity and hospital beds and all that stuff. But again, I don't think, personally, I feel that the focus should be on prevention. And I think that's where the tier 2 clinics come in. And I think the physician advisory group is tasked with doing other things in terms of what protocols need to be put in place for opening up the economy, and things like that. So I think that is what goes on in the meetings. And,
well, we had heard from Dr. Ho. He was basically like, look, we are a tier 2 clinic at AMC, but I don't feel that the physicians advisory group is the setting to bring up this grievance about not getting paid. That's what we were told from.
But I thought the physicians advisory group, I thought you were mentioning that in the executive order, are supposed to come up with the MOA and the reimbursement rates. But members of the physician advisory group are tier 2 clinics.
I think
right?
that would be. I think that would be the perfect forum to make this argument. Correct.
Mm-hmm. Yeah, it just kind of like, well, you guys should know because each of the clinics are represented on this physician's advisory group that are being served, that are serving as a tier 2 clinic.
Right.
And so, it just seems like you would communicate that, and everybody knows what's.
You see Dr. Mike Cruz around, you ever be like, hey, Doc, what's going on? How's that MOU SOP thing going?
Yeah, so, I mean, if the discussion isn't being held, then I can see why we're in this situation, to start with, because the governor's not going to know what she needs to do. She's not going to know the urgency of the matter if it's not being brought up. And
I see.
You know what I mean? So if it's not happening at that level, it has to.
I mean, clearly she doesn't, or at least she didn't portray a knowledge of this issue, because when I'd asked her about it, she said, oh, well, we don't have an invoice. Well, if she knew what the real situation was, I don't think she would say that, because she would know that you don't have an invoice because the body that you tasked with creating a way for these doctors and these clinics to invoice you has not stood up that framework. So when do we reach the point, Doc, where you guys say, we want to be a tier 2 clinic, but God, we're firing doctors? I mean, are you guys going to throw in the towel anytime soon, or where are we?
I don't think so. I mean, we have a duty to serve the public, and we're going to do that in any way we can. Whether or not we're a tier 2 facility, we're going to be creative, and our top priority is serving the people of Guam. We got a great team at FHP, upper management that can help us make decisions to keep the doors open. Obviously, the more resources we have, the better. But it's not going to stop us from serving in our primary role, and that's to take care of people.
Right. I think it's just unfortunate that you guys are stepping up, being a tier 2 clinic, and then having to lawyer up. It's just, it's really sad.
It is sad, and our private sector frontliners are now having to fight to keep their jobs, and it's very, very disheartening and can be discouraging at times. But we're not going to lose focus of what is at hand, and that's to help the people of Guam.
Well, thank you for that, Doc. And
Thanks, Doc.
We're kind of just running this, and we'll talk to a few of the other clinics, at the end of this week, and then into next week, and then find out where, obviously, the Cures team is with standing up these MOUs, MOAs, and the SOPs, and all the other 3-letter things. It's just, I don't get it. And talking to the attorneys, I mean, the vibe I'm getting is they're kind of worried that, they're not in a good spot right now, because we just had a whole oversight hearing where everyone was getting dragged through for paying out things with no paperwork. And now here you guys are with no paperwork. So
yeah.
Yeah, ouch. Thanks, Doc, and keep us posted, okay? And I got your number. Let's make this a regular thing, definitely.
Yeah, we'll do. Thanks for having me.
Okay.
Of course.
Good day.
You
Take
too.
care.
Wash your hands.
Will do.
Okay. Thank you.
You telling a doctor to wash their hands.
Man, that is just something else that, I don't know, in my mind, I'm just like, okay, we paid for meals, we paid for the hotels, we use this process that...
Paid for laundry.
Paid for laundry. we used the process that the governor continuously said was okay and that she had the authority to use. And then they drove that car off into the ditch, and now we're doing the regular way, which begs the question, where does that leave these Tier 2 clinics? And was this an oversight on the part of who? Who messed this up? Is it a mess up? Well, people aren't getting paid, and doctors and nurses about to lose their jobs. So, yeah, I think somebody messed up. It's 9 o'clock. Let's keep on the phones here and go over to Attorney Tom Fisher, who is...
Hey, Chris.
Hi, good morning, Tom.
Good morning, Chris.
I got Sabrina over here.
Hi, Sabrina. How you doing?
Hanging in there. How are you?
Right on. Same thing.
I thought I was going to see you in action earlier this week, but I guess that didn't really happen.
Oh, we had a delay, didn't we?
Yeah.
Yeah.
So
sorry about that.
Oh, no. So what is this that the AG's office was not served? Were they supposed to be served?
Well, I think that's their viewpoint. They're supposed to be served with the writ, but the writ hasn't issued yet. So I'm not real sure that Mr. Canto's correct on that. But nevertheless, we're going to be heard tomorrow.
Mm-hmm. Mm-hmm. And so I noticed that in Adriana's report, there's actually more plaintiffs that have signed up.
I'm sorry, could you repeat that?
More people have signed up to the lawsuit?
Yes. More people have certainly expressed interest, and the reason that we're assembling people who are interested in joining this lawsuit is because of our consideration of asking the court to certify a class of GovGuam employees who are entitled to the money.
Mm-hmm.
What was the feeling after that get you got, where you got a get where it was the one of the attorneys working under the Attorney General who jumped onto this double pay lawsuit? How huge was that? I think that was a
well,
that's what we call a tactical strike.
Well, the employees of the Attorney General's office who were required to report to work during this period are entitled to double pay as well. It doesn't matter what branch of the government you are in, you're entitled to the pay.
Was it just one employee or attorney from the AG's office that joined in? Or are you allowed to disclose that?
Let me put it this way, I won't disclose it. I understand that when the Attorney General's office learned of that, there was a bit of a, I guess, concern would be a generous way to put it inside the office. And I don't want to subject anybody in that office to undue pressure.
Right. So that's what you heard, though, from your client, is that were they asking, like, who signed on to this Fisher thing?
Well, I won't say I heard it from the client. I'll just say that I heard it.
Okay.
But good try.
Nice. Yeah. So, you used to be partners with Canto. What's it going to be like when you guys square off tomorrow morning on opposite sides?
It's actually the afternoon, I think, at 2 o'clock, but it'll be just fine. Jamie Canto will be there to argue whatever position he has, or the AG has, on this issue, and I'll be there to argue the other side.
Do you foresee a delay? Another delay?
I don't see one on the horizon. That doesn't mean it won't happen.
Mm-hmm.
No, I don't see one on the horizon. Today, by 5 o'clock, the Attorney General is supposed to file an opposition if he has one, and then we have basically until 2 in the afternoon to file a reply to that opposition. Okay. But no, I don't see one on the horizon.
What do you anticipate the argument that they're going to make is going to be?
I really don't. I suspect that they're going to focus again on that Section C of the personnel laws. The reason I do say that is because for them to argue something different would be to abandon Lehman Camacho's earlier position, right. And that might be a little awkward for them.
Mm-hmm. I think you were mentioning earlier about Klitsky?
Yeah, I don't know if you got to see the Klitsky commander's public hearing testimony, but it kind of looked like he was siding with Ed Burns' interpretation of that Rule 8 point whatever?
Yeah, 8.406. Yeah, I did see Senator Klitsky's opinion on that. You know, naturally I disagree, and once again, you know, they're ignoring the law, which is 8.406A, which says that in a public health emergency, I can't believe anybody's going to dispute that this is a public health emergency, but in such an emergency, Gov Guam goes home. And I don't recall seeing Senator Klitsky referencing that section at all.
Mm-hmm. And your take on this has been that they're conveniently skipping over that A section and just focusing on the C section.
Right, because it, you know, Section A just really trips them up. And, you know, an effective way, sort of, argue it is to just ignore that section. At least that's what they're trying to do, but it's just impossible. It exists.
Kind of reminds me when you're a kid and you pull the blanket over your head and close your eyes so the monster doesn't see you.
Yeah, yeah, and that's rarely effective. You know.
So you guys go in tomorrow, but the legislature, they're also going in. They have several public hearings on the multiple bills that have been introduced to address double pay, and I think emergency session is scheduled for next week. Which means the likelihood that they may, you know, pass one of the bills or a bill with different components of all the other bills. Would it impact your lawsuit?
No, it won't. I've looked at, what are there, 4 bills now or 3 bills that are out there? No, it's not going to impact the lawsuit because of the fact that no matter what they do, they can't displace this personnel rule.
Okay.
I suppose they can attempt to do so, but no, I don't see any particular significant effect on the lawsuit. I just, you know, you heard me say it before, but I don't understand why the legislature is rushing in to fix something that's not broken.
Yeah, interesting.
So it's, yeah, I guess, you know, I guess each individual senator has a particular position they want to advance, but there's no need to do any of this. The law is in place. All we have to do is follow it.
What's your take on this GFT? I don't know to call it a lawsuit because there hasn't been anything filed, but this effort by GFT, they say they got 600, and I know you're doing your thing and they're doing theirs, but just I'm curious what your comments are on that.
Yeah, but they're also filing it in the district court. They're not going in the...
Yeah, that's true. I believe Mr. Koss said that if and when they get a lawyer, and if and when they draft a lawsuit, that they do want to file it in the district court. I don't know exactly what the jurisdictional grounds for the district court is. I suppose it's some sort of federal labor regulation. I'm not real sure about that. And of course I can't comment on something that doesn't exist, but I would be disturbed to learn that in order to join the GFT lawsuit, you actually have to join the union.
Is that what happened? Because we asked Koss about that, and he was kind of coy about it. He said, well, they are now. So we said, hey, are you using this as a membership drive? And he said, well, what I can say about the 605 people is that they are now.
Right, he said to use the words of Dr. Manglotnia.
Right, yeah.
I suppose his intent by saying that was that they are now members of the union?
Right, yeah, that's what I'm saying.
Well, that's disturbing.
Yeah.
It would be peculiar if an attorney charged a member of a potential class money to join that class.
I see.
It's something that I think would make any attorney uncomfortable.
So that's something that we can ask about then.
Yeah, I would certainly ask about it, and ask him to clarify his position.
How you feel about Judge Sokola? I like her.
Well, I've always liked Judge Sokola. In fact, when I started out in private practice, we kind of shared a wall over at the Terlahi building. So, and then I've appeared in front of her I don't know how many times since she's been on the bench.
What was that part of the debate during the court hearing about, I think, whether or not it was an emergency, or about hearing the case or something like that?
Yeah. Mr. Canto suggested that we are not in an emergency, or it is not an emergency for these people to get their money. I think that that was just well, I don't know why he said it. It just flies in the face of reality. We are clearly in an emergency, and these people who have been exposing themselves to this contagion need the money. And it's not just for themselves, of course, it's for the family. Rent is due, all sorts of things, medical expenses, I mean, you can name it. And there's additional expenses because undoubtedly there are members of the household who have lost their jobs through no fault of their own and because of this virus. I don't know if Mr. Canto's ever been in a position where he doesn't have any money, but I can tell you from personal experience, not having it feels like an emergency. Right?
Yeah, I'll say.
Yeah.
Well,
going into court tomorrow, and hopefully we'll get this resolved. It's just a shame we've had to go this far.
That's what I was just going to say. I think it's shameful that, and this isn't even about taking sides. It's about having lived here and having known so many frontline first responders and essential employees who have worked other emergencies and got the double pay. And I just can't wrap my head around politically what Adelup was thinking when they decided to not pay the double pay and then float this COVID differential, which, I mean, I don't even know what money we're going to use to pay that, and if we can use the federal funds, since it was concocted in the middle of the pandemic emergency. But yeah, I mean, to just, and I don't know if it was just an assumption on Adelup's part, but to assume that people out here don't know what the hell they're supposed to get paid during an emergency, to me, like, I wanted to be in that room where they're like, well, let's just not pay the double pay. Yeah. I mean, what were you thinking? I mean, you were spitting in the face of the very people who are out here trying to keep us safe. I really don't know politically, how did that one fly? I think Governor got to check her advisors because they've been doing her all kinds of wrong during this pandemic.
Yeah, I don't know who the genius was who came up with that thought. I think last night, maybe it was on your news program, that the governor was saying that the economic impact of this pandemic will not be as great as people have assumed because so many federal dollars are coming into Guam. Well, if that's the case, I don't understand where the financial strait exists that we can't pay the people.
Right.
So,
Yeah.
pay them.
Yeah, it is kind of conflicting when she says, oh, we can't pay it, we can't afford it, but then it's like, oh, but we're not going to be that bad off because we got all this federal money.
Yeah, and then then all these employees have to, come to the government of Guam hat in hand, begging for what's already theirs.
Right, that's the part that I think doesn't sit well. And then when I want to go back to politically, if you could hear what these frontline first responders and essential employees are saying about the administration on this, oh my God. And I think that's like, if the governor could hear it straight from these people, she would probably do a 180 so fast she might hurt herself.
Well, I won't disagree. All you have to do is, again, let's follow the law. We do that, that the law emerged as a consensus of all the people on Guam. I mean, that's the theory. And since we are giving double pay to these frontliners who are working during a public health emergency, let's start cutting the check.
Yeah.
Well, good luck tomorrow.
Yeah.
Well, thank you very much. I appreciate the opportunity to speak to you guys and to your listening public.
All right.
Yeah, definitely.
Take care.
Thank you very much.
Wash your hands, Tom.
Heck no. Of course not.
Such a rebel. Okay.
Yeah. All right. Thank you.
Yeah, of course.
Ay.
Wow, that's going to be a good one.
We can't pay double pay, but we can hire people.
Yeah. I mean, it's just really I've been saying it all week, the messaging, the communications. If you're going to say out of one side of your mouth that, oh, we pay this double pay, we're going to have to furlough everybody. But then the other side of your mouth, you're hiring political cronies. It just, God, really, you don't see how that looks? 9:14. So, hey, I wanted to throw this video up. This was something that we had talked about yesterday, the food commodities.
It's a beautiful video.
This is a really nice video. It's It was cooked up. I'm going to play it on my end too. Okay, let's sync it. This is a video that was released yesterday afternoon. And where's it at? Over here, buddy.
Yeah, so yesterday morning, we had John Fernandez on the show because they had just launched, I guess, their new site for the emergency food distribution program.
Right.
Because as many of you know, when they launched it last week in Petey, it was crazy. There was so many people. That's the unfortunate thing, that there's so many people who are hungry and waiting in line for hours. And it caused such traffic congestion that DOE work with, I think, Pacific Unlimited, Matson, and they reached out to employees over at, I think, Department of Public Works and the Port Authority to help out, and they launched a new site yesterday at Upper Teadsden.
Right.
And it started at 6, but we got the word from Adelup at 5:30.
Right.
That there was they reached their maximum capacity of cars.
Which was 2,000 food bags were given out. So can you imagine 2,000 people lining up to get a bag of food 3 hours before the distribution even starts? I mean, the need was so great that before they even gave away a single bag, they had to turn away all kinds of people because people are struggling, people are hungry.
And this is also a program that the Guam Department of Education has been doing for years.
Right. And so I called it. When we saw the governor, they showed up, saw the cameraman. I was like, oh, well, they're going to do one of these commercials. And so we're going to just play it for you guys. We'll talk about it and discuss our thoughts on it. So again, this is the latest campaign commercial. It's not really a campaign commercial. It just looks like one. On
COVID commercial.
COVID commercial.
This is a part of the Emergency Food Assistance Program, and it always has been in existence. But it's only provided to those that are of low income or under SNAP, WIC, TANF, Temporary Assistance for Needy Families. Today, this is one of our sites that we're mobilizing. We usually are down at Speedy, that's our regular distribution site, but now we're having to go out to the central and the north. So the commodities, they come from trade mitigation from USDA. We also have entitlement dollars to actually order these food. So today we have rice, there's tomato sauce, there's orange juice, there's canned beans, there is a can of beef, pork, salmon. Those are all a part of the different commodities that we have here. This is important because this is part of COVID-19, and we know that everyone out there, the stores are kind of scarce with a lot of food, so everyone is in need. Through the disaster household distribution, all you need is, it's open to all, so we're looking at their ID and then and asking them what village they're from. The team we have is part of GDOE's food service staff. We have the Child Nutrition Program staff, state staff, and then we also have DPW staff that has helped us tremendously. I want to thank each and every one of them. I want to acknowledge Jesse Garcia, Dominic Muña for helping us throughout this whole entire thing, the governor, and then of course our Superintendent of Education, John Fernandez.
I like that music.
I do too. By the way, where was John Fernandez? I didn't see him in that video.
I saw the governor a few times. Yeah, where was John Fernandez? He was there, though, because remember he told us yesterday he was there. I just think that this is just, I mean, come on. You're going to take credit for this. You're going to try and steal DOE's thunder. I mean, GDOE has been giving out meals with the grab and go since the start of COVID. They have been busting
ever since.
They've been busting their ass, and for you to show up randomly one day with your cameraman, and then we're going to get a little video where you just look like the hero. It is what it is. I'm just going to say it is what it is. And I called it yesterday. I said, watch, they're going to come out with a video. But, I mean, it's a little tone deaf to me because what do we have here?
We're showing people who are hungry waiting in line for food.
Right, and you're trying to spin that into some kind of like, hey, look at all these people lining up for food, man. Isn't that great? We got orange juice, we got salmon, I mean, these people are hurting. And the commercial says nothing about all the people who were turned away. And it's just kind of self-serving. I know, the governor's office did it. Yeah, and that's what I got to kind of laugh about is GDOE's been busting their butt since the beginning. I mean, John Fernandez has worked hard to ensure that we have the ability to feed people even when there's no school.
Yep.
I mean, he has been on the phone to Zoom with the feds.
Trying to figure out school,
right.
Distance learning,
of
the
course.
grab and go.
Right.
I mean, we could go on and on.
We can, and I want to.
And I don't even think I've seen him once at a press conference at Adelup, or even a shout out for him being a COVID hero.
I mean, God, name GDOE. You're going to name Iglesias and Cristo COVID heroes? Like they spread the virus. What are you thinking? And I just knew it that once the politics got involved with it, I mean, it's unfortunate. That's what happened. It's like you turned it all political, and this is a federal program. And it's a federal program that I remember we had John on the show, and he was talking about, I want to get these commodities out because we have these commodities.
These are all federal programs.
Yeah, and that's the kind of the thing is when I was thinking about it, I went on a beach walk run last night, and I was really thinking, man, why do I have a problem with the governor and the administration taking credit for all of the federal money, the Ajuda Programan sa Lapi para Benelas Dagon ni Tautau? That is federal money. What is the other one? The GITA one?
Small business one.
Small business, impossible to get loan program.
Yeah. The PPP.
That's all.
The
with
EIDL.
The PPP, the EIDL. And if you go on the governor's Facebook, she has all these videos from these business owners who got the PPP that has nothing to do with Adelup at all. You don't go to Adelup to fill out an application. You don't go to a government of Guam agency. You go to SBA.
The unemployment that's coming out.
Right. Yeah, the unemployment's federal, and Lord knows that's got some issues. So I think the problem that I have with it is now we're trying to get our picture taken with, all this federal stuff that's happening. But when we didn't have the federal and the media was asking the administration, what are you going to do in the meantime to bridge the gap for our people? What are you going to do while we're in this desert waiting for the stimulus, waiting for the unemployment? And the answer was, hang in there. Hang in there. Go apply for the local assistance is the federally funded SNAP benefits. They kept saying that. That's not a local assistance, a federal program. Well, that's just the problem I had with it. It's when we asked, what are you going to do for your people now? The answer was nothing. That's hang in there, guys. You all right? Or hang in there. But now that, we have all this federal money that it's now we want to shine. And not only that, but I mean, God, if you're going to do a video like that, maybe make it less self-serving. What was the purpose of that video? Was it educational? Yeah, it told us a little bit about the program. Did it tell you where you can go get these commodities? No, it didn't. Did it tell you what days you can get them? No, it didn't. It should have. If I'm going to do a video like that, Bree, I'm going to go all out. And I'm going to put in the graphics this is our commodities, this is what you get, this is where we are on Friday, this is where we are on Monday, this is how you can get it, this is how we advise you show up early to get it. If you're going to put out an informational, educational video, that's, of course.
And to your point, Chris, I don't think they could use the excuse of, we didn't have the budget to produce the video for, you were just commenting on the missing text, because that was a very well produced clip.
Oh, they got
it. It was shot beautifully, and it was edited very. And we know a thing or two about editing video. It should have had some sort of tech support.
But really, good job to GDOE throughout this whole thing. I mean, and they're going to be working over the summer with the grab and go meals program, and I believe even this emergency disaster food distribution program, which, by the way, continues tomorrow at the Upper Teason baseball field, and at the Dededo, I have it here, the Dededo Farmers Market, I think. Let me just make sure that's correct.
Yeah, the Farmers Market.
You're sure? Yes, it's the Dededo
Yep.
Farmers Market. Again, this is tomorrow, 6 a.m. to 8 a.m. or 10 a.m., 6 a.m. to 10 a.m. But I think it was yesterday when John, did he say that they were waiting like 3 hours before it even opened?
Right. Yeah.
You know what?
We heard from people who showed up at 3 a.m. Some of them got the bags, others were turned away.
You know what really kills me, guys, is
And it's 2,000. I'm sorry, 2,000
Yeah.
first come, first serve.
Right. Yeah.
Is with both of you being parents, and I am not. There's still that emotional part about like, okay, you're trying to provide for your family, so it's like you wake up the kids super early. Everybody get in the car. I know we're hurting, we're hungry and everything like that. We're gonna go line up. It's probably gonna be for a very long time, and you go there, and then for whatever reason, you're not able to get like the meal, and then your kids are in the back of the car saying, "Daddy, I thought we were gonna eat." And you got no other choice but just to go home. And you're embarrassed in the face of your children.
That's when you cry.
Yeah.
As a parent, that's
you're
when you
frustrated.
cry.
Yeah. And again, I'm not a parent, but I can only imagine, the emotional gravity of what that's got to be like, being, the figurehead for your family and trying to, explain to your little ones, we tried to make it happen. It didn't work out. I mean, I cannot imagine what that drive home must have been like for so many people.
And there's so many people that are feeling that way. I mean, we heard it from the Salvation Army, who said they've seen an increase, people they've never seen before. Catholic Social Services, the same story. And just by seeing the sheer number of people in these lines.
I mean, I don't know how the governor didn't.
Heartbreaking.
I feel like it should have been a wake-up call for her. I feel like seeing that and seeing the number of people were turned away. I don't know. I would have rolled into that press conference like, our people, we're going to do this CARES Act. Let's do a mass feeding. Let's buy some food. Let's do this. Let's do that. Instead, we get this. It was the best food distribution ever because the governor was there. And then I want to go back to the video, right? So, what's crazy is like at the start of the COVID, they hired this guy who has a video company, and now he works for us making videos and doing whatever. But I just kind of thought it didn't sit well with me knowing that there are people lining up to get these bags of food being videoed by a guy who's probably making 2-3 times what they're making, if they're even making anything, because so many people have been laid off. And then I kind of thought, like, is that really an essential employee? The guy who shoots propaganda videos for you, he's essential? I guess so. I was frustrated because I felt like GDOE has worked so hard, and here... It's like, you ever had that one cousin who doesn't do anything, and then they show up, and when all the elders are around, they're like, oh yeah, I did this, I did that, huh? Like, you just got here. You didn't even help set up the canopy. And you're taking all the credit? Yeah, it is what it is, though. 9:27. Hey, we got John on the line here as a comment. We're talking about local assistance, John. So you were saying that you think that the local government should have done something to kind of mirror what the federal government was doing, right?
Yeah, I mean, I don't understand how... Oh, anyways, good morning, guys. Sorry.
Good morning.
Good morning.
I should have said morning. I don't understand why they just didn't mirror or match what the stimulus checks that they gave out. So it's kind of like a little extra that we can live off of, rather than prolonging all this unemployment. And they've had the money, right? They have it, and they didn't even at least match it, or I don't know. They should have just followed what the federal government did, right? All the taxpayers, 2018, 2019. Why nothing? I mean, I'm in kind of like the middle class, and I'm struggling big time. Not as much as these other people, but we're all struggling, right?
Right.
I just don't understand why they didn't do that. It could have been, everyone could have got twice the amount they were given with the stimulus, and they could have lived off of that for months. But now we're waiting for this unemployment, waiting for the government to do something. There's so many paperwork that you have to fill out just to wait a month or two to get your money. Doesn't make any sense.
Yeah. So how
I don't
are...
know. I mean, my wife and I are like pretty much like at the bare minimum now.
Yeah, John, you know, a lot of people talk about, and we had the Republicans on, they were saying like, hey, the middle class is left out. They don't qualify for things. Is that accurate?
Yeah.
Have you applied for any of this?
Very, very accurate. Very accurate. We don't qualify for SNAP. We don't qualify for the extra money that they give out to the SNAP benefit people. I mean, I'm not trying to knock on them, but we're struggling big time. I mean, we have a mortgage, we have cars, we have bills, and like we're living off our credit card, which is almost running dry, basically. There's no more credit for us to use. That's basically what I'm trying to say.
Right.
And Guam is just like twiddling their thumbs, waiting for us to what? Die of starvation? Is that what they're waiting for? For people to die? They're going to have more people die from starvation than they did with the COVID.
Are you and your wife still working?
We just got back to work.
Oh.
But we still had 2 months of no work at all.
Right. So what was rock bottom for you guys, John?
Rock bottom is my wife and I recently acquired our 2 grands. And it used to be just 2 of us. Now we have 2 other bodies that we take care of. And it was hard. I mean, my family, luckily, with, you know, our island-style lifestyle here, we all pitched in and helped each other. But what if we didn't have that? What if with the people that don't have that? Like you said before in your telecast, there's people out there that it's just them. They don't have no one to depend on or to help them. It's sad. It's really sad. I mean, this political game is baloney. It's really too much. I kind of lost faith in the system already.
You're not the only one.
Yeah, and it's always, I'm sorry to say, but the rich get richer, and the poor in the middle, they don't get crap. Especially us middle class, we're always forgotten. We're always like, they're okay, you know. It's baloney. It's too much.
I mean, you're right, because the assistance programs that they have rolled out, there was the one for people earning under $10,000.
Yeah.
And then the people on SNAP have been getting these reloads of emergency SNAP benefits, and then the Ajuda Programan Salapi para Ajuda y Tautod and Buenos Dogwood, that one is also for people who would normally be on SNAP. So I mean, and I hear it, but then I also hear, John, people saying like, oh no, these middle class people, they would apply, they qualify.
Nope, we don't. There's so much. You qualify, and then we go in and we go down the list, and like, oh, first 9 automatically qualified. And then these people that make 10,000 or less, 9 times out of 10, or maybe 10 times out of 10, still live with their parents, only have part-time jobs. Most of the time, probably are students, just trying to make extra money to live off. But they don't have mortgages, they don't have cars to pay, they don't have insurance for family. You know, those kind of things. They don't. I'm pretty sure they see it, but it's just like turning a blind eye to it.
Mm-hmm.
Doesn't make any sense.
But
like, I'm sorry, go ahead.
No, I was going to ask, what would be your response, though? I mean, if the administration has said that, this is an unprecedented health emergency. No other governor has been through anything like this. It's in the world. Everybody's going through this. And they're having problems in the states with getting money out to different jurisdictions. So it's not an isolated problem here. What would be your response to that?
Keep it simple. Keep everything simple. The more simple you keep it, the better. So basically, if you have the money, give it. What is with all the holdup? It doesn't make any sense. It's like me having no money in my bank account, right? Going to the store, I know for sure I don't have money. Of course, I'm not going to buy anything, but if you have the money, you're going to spend it, right? It's so simple. Why don't they just mirror what the stimulus checks that they gave out last week are still giving out? Mirror that. You have all the information as revenue and tax. Why don't they you go off that? Why do we have to apply? Why do we have to wait for this unemployment program or whatever? It's easy to say, but I want to see the governor or whoever, these senators,
who are living pretty well off, do all that paperwork, wait a month or two for money that for sure you don't know if you're going to get. It doesn't make any sense.
Mm-hmm.
And people are starving. I mean, look at those lines that Mr. Fernandez provides for DOE.
I thought the governor provided.
We're able to do it, but the governor of Guam can't. How is he able to do it and the governor can't? Maybe the governor should take advice from him.
Well, thank you, John. Man, I feel your frustration, and we're glad we got you on to share that.
Thank you, guys. I appreciate it.
God bless you, man.
Take care.
Wash your hands.
I will. I always do.
Okay, John. God bless you, man. Okay.
Thank you.
Yeah, people are frustrated. And I could just hear Adelube would say, well, we don't have the money for it. But, I mean, could we have done a better job of reaching more people? Yeah, we could have. I mean, we hear people complaining about this application process for the Ajudan Programen Salapi program. But could we have taken that $40 million and just said, hey, everybody's going to get $500? Yeah, we could have. The governor has the authority, the superpowers. 9:35. You okay over there?
Yeah,
It's just frustrating. Yep, it is. I mean,
you don't
because
like to hear, how people are really.
I see it every day, man. And you know what's crazy is there's a million Johns out there.
Mm-hmm.
You know what I mean? John is just the one who called.
Yeah, and you could hear it in his voice, his frustration, and
yeah. I mean, what are you going to tell him? Go apply for food stamps again?
And, that's kind of what we were talking about, just a few minutes ago before John called. And, he said that he and his wife, they've got 2 more bodies to provide for now. They're looking to him. Probably he and his wife, but, probably like Guamanian culture and everything like that. Predominantly, he would be the one to say, like, okay, here's what happened. Here's what we're going to try and do next. I mean, it's heartbreaking.
Sure is, Jay. We're going to take a little break, and we're going to come back and talk with one business that is looking to reopen tomorrow in light of the governor's new easing of restrictions. Again, it's the KUAM News Takeover, Guam's favorite, containing COVID. Good morning.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
Be healthy. Be informed with ITD.
We hope that you and your loved ones are safe and healthy during the COVID-19 pandemic. It has been a challenging time for all, but now, more than ever, our cancer patients and caregivers need us. Although we are apart, we stand united in the fight against cancer. The American Cancer Society Guam is excited to announce our first virtual Relay for Life. Join us on Saturday, June 27th at 6:30 p.m. on KUAM TV 8, as well as on I-94 FM and streaming on KUAM News digital platforms. Cancer does not stop, and neither can we. On June 27th, let's celebrate together and fight cancer. Visit cancer.org/GU to find out how you can participate in the 2020 Virtual Relay for Life Guam. Calling all graduating seniors. Join us by showing your class pride in the celebration caravan you deserve through the island's major thoroughfares. KUAM and its partners want to recognize your accomplishments and help celebrate this pivotal moment in your lives. To participate, email promotions@kuam.com and let's get this show on the road. Special thanks to ABC Stores Guam and The Dungeon.
Be healthy. Be informed with ITD.
Good morning. It's containing COVID. The KUAM News Takeover, Guam's favorite, I-94. Hi. Good morning, Sabrina.
Good morning.
Let's go to the phones. Hey, coming up, we're going to end the show on a good note. And we'll find out more about what they're going to do for the distribution tomorrow. I mean, I'm thinking if we know people got turned away, I'm just thinking that they're trying to figure out a way. I mean, A, can we get more food to give out? And B, is there a way to do it? I mean, because it was a big logistical improvement, I guess, right? But you trade that for people getting turned away, it's still not a good look. 9:43. Good morning. Let's go to the phones where we have Sam from Custom Fitness on, and you guys are. So let me get this straight. It's not a gym, it's a box, right?
Good morning, Chris, Bree, and Jason. How are you guys doing?
Good morning. So we want.
Yeah, I mean, you know, it's just a technicality, I guess. There, I think more of the restriction is going to be on class-based facilities versus, you know, kind of going in and doing your own thing.
Right. Mm-hmm. And so this kind of rapidly evolved where we were talking about last week. It was like, hey, we think we can open if we adhere to the social distancing. Now it's like, oh, you are opening.
Yeah, so I mean, I believe we're able to open tomorrow. We're going to kind of give it some time to just make sure we have all our ducks in a row. So we're planning to open on Monday, June 1st, clean slate, beginning of the month, Monday, get everyone back into the swing of things.
Oh, you just, June 1st is Monday. It's already June, everyone. Wow. So Sam, how key was because you guys we've done a story on it. I think it was last week with Adriana, or maybe this week.
I think it was Monday.
About the preparations that you guys have already done. So how much more prep did you guys have to do, or were you already in a place where you're like, oh, we're good?
Pretty much the only thing we need to do is set up our scheduling system so that way people have a slot to come in. I mean, our physical therapy clinic opened the beginning of May, so we've kind of already had all our sanitation procedures and protocols in place. And, you know, luckily for us, we're not really reinventing the wheel. Places in the States are already opening. So kind of model what they're doing and see what works for them and learn from their mistakes and go from there.
Mm-hmm. For people who have been to a custom, and, you know, you guys are all following the same guidelines and guidance, but how's it going to be different when you go in for a class? What's going to be different now that we're opening under this COVID pandemic?
So we're going to be a little bit more strict with, you know, who can come in at what time. You're going to need to register ahead of time. Areas are going to be marked off so you have your space ready to go. Set equipment for each person so that way there's no sharing of equipment. You're not really, you know, invading anybody else's space that might be working out, you know, with at a minimum of 8 feet away. You guys have been to our facility, so you know we're not short on space. So I think we can accommodate people without them feeling cramped and still adhering to all the, you know, protocols, making sure that people are safe. And we have installed, I know you're real big on washing your hands, so we have installed additional sinks. We have one outside the door when you enter, and then we'll have one in the back. That way, if anyone needs to wash their hands when they're done working out.
Mm-hmm.
You should just institute that as part of the WOD. Like, okay, 10 burpees, wash your hands.
Yeah, exactly.
So again, how does this work? People have to call first and schedule an appointment, or you guys have your set classes, or just cutting them in half? I mean,
so we're gonna. It's actually a system we're getting together. That's the only reason why we're not, you know, gonna open tomorrow. We just want to make sure that we have that squared away. So it's going to be a booking application where you sign up for your class ahead of time and you have your slot secured.
I see. With a cap on how many people.
Right. Exactly. Yeah.
Okay.
So, how many people do you guys normally get for, like, let's say the 5:30 class, and then how is that going to change with the social distancing and everything?
So before we didn't really limit the amount of people at any given time. We would have multiple classes going on, different programs at any, you know, set time. We had the run team going on, 5:30 a.m. class. Now it's going to be kind of limited to just one specific class. And then there won't be, at least for the first couple of weeks until we know more or see how, you know, making sure that there's no influx of COVID patients, then we'll, you know, we can always adjust from there. But at least at first we're going to be real, you know, cautious, making sure that we don't, you know, get ahead of ourselves too quickly.
Right. Mm-hmm. And so you guys are a fortunate big facility. If we're operating at, what is it, 50% capacity?
Yeah, 50%.
Yeah. So what do you guys, so let's say I want to go to the 5:30 class, but I want to have an idea how many people can go.
So I think at least for the first week, we're going to cap it at about 15 people per class. So I mean, you're looking at each person can get at least 20 square feet of space to themselves.
Right. And so and how many classes per day, just so people know, okay, I got a chance?
So we have 6 classes per day, and then we are going to have limited open gym hours, and then we're planning on also kickstarting our teens program for the summer. I know a lot of kids haven't really had any outside activity, you know, it give them a chance to do something, get healthy, get back into the gym. Mm-hmm. So hopefully we'll be able to launch that within the next week or 2.
Okay.
What about the rustiness?
I'm sorry?
The rustiness. I mean, man, how many of us have been saying, oh, I can't work out because the gym's not open now. Oh, guess what? Mm-hmm.
Well, I hope you guys have been following our segments. You guys, KUAM's been sharing
I've been sharing them.
I'm pretty sure that's what most people have been doing, just sharing them. So we've been, you know, doing programming. People have been staying active, but of course, you know, with CrossFit, you know, it can be scaled down to any level. So you can, you know, make it as easygoing as you want at the beginning, and then scale up as you get back into shape.
Mm-hmm. Gosh, I could just imagine that first class back, right?
Ooh, boy, people are going to be crying.
Paul and Ryan, oh, you missed me, right?
Oh, yeah, where you been, huh? Yep, quarantine cooking, right?
500 squats.
Yep, Tulip, right? Oh, Chris, Tulip, right? Yep,
Yeah, I'm pretty sure they're sitting there rubbing their hands together, plotting some evil.
Rubbing their buff hands together.
Bree, you need to change your attitude.
Yeah. So what are people saying, Sam? I'm pretty sure that you guys, the chats are just blowing up with people who are excited about coming back.
I think people are super excited. There are a couple people that are still kind of cautious. Those that live with, older family members or people that are immunocompromised. But like I said, we're doing everything in our power to make sure that we're doing it safely and properly, slowly at first, so that we can make sure we can prevent any influx of sickness. But I think people are super excited. I mean, I can't really keep up with the messages I've been getting, the emails. When are you guys going to open? So I know everyone's really excited to get back. So we're excited. We've been closed for
Well, I'll tell you what,
2.5 months.
People of Guam really need a workout after the last few months of just...
And I mean, something to look forward to. I think, it builds morale. They say, exercise, promotes endorphins. So we want to make sure that we do our part to keep the island healthy and happy.
Right. And like you said, it is such a big facility over at Custom. I mean, you guys could do indoor, outdoor, classes.
You could probably have like yoga, Pilates at the same time, right?
Yeah. So we are actually, I don't know if you've attended our yoga classes. We do it out on the deck upstairs. So they are going to be resuming that as well next week.
All right. Okay.
And that won't even impede on our count downstairs at all.
That's good. Good to hear. Sounds like you guys are ready to go. Monday, what is going to be the first class that you guys have on Monday?
5:30 in the morning.
Okay.
And that is just the typical Death by CrossFit class.
Exactly, with the evil plot of.
If my burpees are not where they need to be right now,
We can mark off a space just for you. So
I need a little,
you can do your burpees.
because I move around when I do the burpees. It's like I start in one place, then by the time I'm done, I'm like, how did I get over here in Aspen?
We'll open a little early for you. That way you can make it to your 6 a.m. show.
Thanks. Appreciate that. All right, Sam.
Thanks, Sam.
Thank you, guys. Hope to see you guys back in the gym soon.
Us too, yeah. Definitely. Hey, I've been doing stuff.
We'll reserve a spot just for you guys.
You guys got to check on Bree because I've been doing my squats. The thing is though, with the home workouts, you guys, there's just too many 3 digits. What? I saw something over the weekend. 300 squats. Are you
Murph.
The Murph, yeah.
Well, that one is a hero one. So that one, they didn't make that one up on their own. They can't take credit for that torture. But yeah, we're excited. We're ready to get back into the swing of things and get moving.
Hey Sam, this is Jason Salas. Good morning. Good to hear from you. It's been a while. We do have a comment right now from somebody is so ecstatic that you'll be resuming your normal or normal-ish business. San SP is saying, I'm so happy when we work out, let's do the electric slide. So technically you would then be a fitness and a dance organization, right?
Yes, we can accommodate that, and we could still do the electric slide while maintaining social distance.
Very nice.
So whatever gets you motivated.
Right on. And hey, Sam, I guess with people, staying home for how many months? I mean, obviously we haven't been getting the amount of exercise that we're supposed to be. Are you guys anticipating an influx of new customers?
I hope so. I mean, we realize that, a lot of people are without jobs. So, it's, and obviously we're, a pay-to-play kind of facility. But hopefully, we can make accommodations and try to accommodate as many people as possible and, have them prioritize their health.
Right. Yeah. Do you guys anticipate continuing some of those, posting the WODs on your Instagram and Facebook?
I'm not sure. I think we are going to we're going to try to do a big finale on Monday. That'll be our 50th segment. But as far as continuing them, I do think it's been really helpful and beneficial for those that don't have a gym membership.
Right.
So, that's something we can definitely consider.
And I mean, you've got 50 of them, so people can always go back and.
Yeah, exactly. And if you've only been sharing them and not actually watching them, then now's the time that you can go back and start from segment number 1.
Mm-hmm.
There you go, Bree. Right. I think that was for you. Thanks, Sam.
Thank you, guys. Okay. Take care and wash your hands.
You got it. Wash yours first. Okay, after you. All right, bye. 9:54. Hey, we'll take a little break. We'll come back and end the show on a good note. It's the KUAM News Takeover, Guam's favorite, containing COVID. Good morning.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
Be healthy. Be informed with ITD.
Calling all graduating seniors. Join us by showing your class pride in the celebration caravan you deserve through the island's major thoroughfares. KUAM and its partners want to recognize your accomplishments and help celebrate this pivotal moment in your lives. To participate, email promotions@kuam.com and let's get this show on the road. Special thanks to ABC Stores Guam and The Dungeon.
Be healthy. Be informed with ITD.
Hey, good morning. 9:58, as we always do. Let's end this show on a good note here. It's containing COVID. We're going to bring on Irene Santos, who has done a great thing, man, Irene. Good morning, Irene.
Good morning.
So you were behind it. I saw it on Facebook, and I was just like, wow, this Adopt a Grad. We know the class of 2020 just struggling with not being able to end their senior year in the way that we're all used to, in the way that they were looking forward to for so long. So You kind of stepped up and are providing this service that I think is really great because it's helping these graduates find silver linings where there were only gray skies. So can you tell us about how you came up with this idea, what the reaction is, and who it has helped out?
Well, I actually found the idea from one of my friends. She needed help with coming up with ideas for a male graduate she was adopting. So I looked into it, and since our graduates are missing out so much this year, so I asked the community for help, and that's how the Adopt a Grad was created. The community has been amazing. I knew people would want to help out our grads, so I didn't know that we would get so much support. So I was worried we would get a lot of graduates, but we wouldn't get enough members to adopt the grads. So I was surprised that we had more members looking to adopt grads than we actually had grads.
That's amazing. And so people can still adopt a grad, Irene?
Yes. Well, a lot of people have been sharing it. So maybe on a day we can get about 5 to 10 new graduates, but then people are so fast they can only be up for a minute, and then they would change their status to adopted.
Wow.
Yeah.
And then so if you adopt a grad, what does that involve, Irene?
Well, the person, they can go out and get balloons, lays, a gift card, anything just to make the grad feel happy, to make them feel that we care. Yeah. And
how many grads and adopted, I don't even know what the word is. How many? Yeah, adoptees, or how many grads have you paired up with people to adopt them?
We have 166 graduates so far. I don't know how many grads, how many adoptees we have. We have so many. Wow, that's great. And so, but you're getting grads, so people reach out to you. They say, "Hey, this is the grad in our family. How can you help?" And then you put them up on your site, right? Actually, they post the grads up themselves. Okay. They post a picture with a brief description of the grad and where the grad went to school, and then that's when the member comes in. All I did was just make the group, actually. Right. So, yeah. So they do everything on their own. Nice. And so what do you hear back from these grads or even the people who help them out? A lot of people are thanking me. It's weird because I don't really get that kind of, things said to me. So they're thanking me and they're God bless you. You're so amazing. No, you're amazing. Thank you for supporting. And that's why we wanted to bring you on, Irene, to just show our support for the good work that you're doing, especially because all the grads are just struggling with COVID and how it's bulldozered their graduation ceremony. So we wanted to bring you on and just share with everybody that we think you're a COVID hero. Thank you. Don't you cry on me, Irene. God bless you. In any way we can help get the word out for the good work you're doing, you just let us know. You got my number, okay? Okay, thank you so much. All right. God bless you. Wash your hands. Okay, you too. Okay, bye. There you go. 10:03. I tell you, so many people on this island have stepped up to really fill in a lot of the voids and the gaps and the emptiness that's been created by this pandemic. Sabrina, good job today.
Good job.
I think she's just still struggling with the call we had with John. I mean, yeah, it's every day is a wake-up call. Every day. Jason, good job today. Joe, sir, also on our digital stream team. To you guys out there, thank you so much for watching KUAM TV 11. Again, thank you. It's 10:03. We're KUAM FM. Agatna, Guam. This has been the KUAM News Takeover of Guam's favorite. Going to end here with a song that I absolutely never get tired of hearing.